She's there out here.
All right, I think we're ready to get started. Welcome to the Appropriations Committee hearing. My name is Rob Clements. I'm from Elmwood. I represent Legislative District 2, which is Cass County and Eastern Lancaster. I serve as chair of this committee. We'll start off by having members do self-introduction, starting with my far right.
Myron Dorn, District 30.
Robert Dover, District 19.
Mike McDonald, LD5, South Omaha.
Lauren Lippincott, District 34.
Steve Erdman, District 47.
Thank you. Assisting the committee today is Tamara Hunt, our committee clerk. To my left is our fiscal analyst, Michaela Finley. Our pages today are Malcolm from Omaha, UNL student, and Kate from Kansas, a UNL student. At each entrance, you'll find green testifier sheets. If you're planning on testifying today, please fill out a green testifier sheet and hand it to the committee clerk when you come up to testify. If you will not be testifying but want to go on record as having a position on a bill being heard today, there are white sign-in sheets at each entrance where you may leave your name and other pertinent information. These sign-in sheets will become exhibits in the permanent record after today's hearing. To better facilitate today's proceeding, I ask that you abide by the following procedures. Please silence your cell phones. Move to the front chairs when you're ready to testify. The order of testimony for bills will be introducer, proponents, opponents, neutral, and closing. When we hear testimony regarding agencies, we will first hear from a representative of the agency. Then we will hear testimony from anyone who wishes to speak on the agency's budget request. When you come to testify, please spell your first and last name for the record before you testify. Be concise. We request that you limit your testimony to 5 minutes or less. Written materials may be distributed to the committee members as exhibits only while testimony is being offered. Hand them to the page for distribution when you come up to testify. If you have written testimony but do not have 12 copies, please raise your hand now so the pages can make copies for you. And now we will begin today's hearing with Agency 25, Department of Health and Human Services, and the Public Health Division is going first. Welcome.
Thank you. Good afternoon, Chairman Clements and members of the Appropriations Committee. My name is Charity Menefee, Charity Menefee, and I am the Director of the Division of Public Health within the Department of Health and Human Services, or DHHS. I'm here to testify in support of the Governor's Budget Recommendation LB 814. The Division of Public Health serves the entire population of the state of Nebraska. Public health's critical role has come into focus over the last several years as we've come together as Nebraskans to first respond to the move beyond the COVID-19 pandemic. Along with the strength of the community here in Nebraska, public health delivers on the DHHS mission to help people live better lives. Governor Pillen's budget proposal includes several critical investments in public health infrastructure that will improve the department's ability to provide Nebraskans with efficient and effective government services. With that in mind, I would like to thank you, Chairman Clements, and the members of the Appropriations Committee for allowing me the opportunity to be before you today to highlight the importance of these investments. This proposal includes $11.5 million to bring the vital record system into the 21st century. Of this, $5 million will come from the fee revenue we have saved over several years for this purpose. Along with additional funds provided in the governor's recommendation, we will digitize physical records, replace aging data systems, and provide improved accessibility to Nebraskans, both in person and online. The data contained in these systems is utilized across state government for official duties, such as with the Secretary of State for the prevention of voter fraud or the Department of Motor Vehicles to ensure up-to-date information for the driver's license registry. Improving these systems will allow the department to serve Nebraskans' requests for birth, adoption, death, marriage, and dissolution certificates more expeditiously. The governor's recommendation also includes $4 million to integrate public health systems through the Data Nexus project. This project will allow the department to bring many disparate data streams together. The ability to integrate information across data systems streamlines the department's ability to identify risk and protective activities quickly and with better accuracy, allowing for better resource allocation and prevention services to all Nebraskans. Finally, the governor's recommendation includes critical funding to sustain operations of the statutorily required cancer and Parkinson's disease registries. These registries are used to identify risk and protective factors, as well as supporting research initiatives for improved prevention efforts and treatment of cancer and Parkinson's diseases. The recommended budget also authorized distributions from the Healthcare Homes for Medically Underserved Fund that supports access to healthcare at community health centers. In summary, DHHS supports the governor's budget recommendation, LB 814, which provides necessary resources to serve Nebraska's public health system. We respectfully request that the committee approve the governor's budget recommendation as well. Thank you again for the opportunity to testify today. I'm happy to answer any questions.
Thank you. Are there questions from the committee? Senator Erdman?
Thank you, Senator Clemens. Thanks for coming. In your testimony, you said approving these systems will allow the department to serve Nebraskans' requests for birth, adoption, death, marriage, and dissolution certificates more expeditiously. So I've had issues with constituents trying to get their birth certificates. Can you find expeditiously? What does that mean?
So right now what happens, Senator, is there's several pieces of this, and I'll back up to a little bit. Our data system that we have in place right now is about 20 years old. The last time that it was updated fully was in 2016. We've continued to try to update it, but because of the age of the system, it will often crash. Just putting it as simply as I can. That then will provide delays sometimes for both people that are trying to access the system to input information for the records, birth certificate records and that type of thing, and also for people that are trying to access the records and utilize the systems that we have. And so that's where we're trying to get to being more efficient with a more effective system that's not crashing and not being able to support Nebraskans and getting that. So some examples for what happens right now to register a new event. If a baby's born today and they're registering that birth certificate, it can take, if everything's going smoothly, about 25 minutes. What happens sometimes is that you'll get most of the way through that record and the system may shut down and they have to re-enter. So then that takes more time. We're hoping to get that down to about 15 minutes or less just to put the input in. And then the same thing could happen on the other side of the, from the public side when they're trying to access the records. Does that answer your question?
Okay, so if one makes an application for a birth certificate, a duplicate, how long should that take?
So it should be, if it's able to be electronically received and moved through, are you talking about for it to be physically sent to them? That should not, this does not change that. This really is addressing the processing of the records. I can get back to you on the time frame to receive that. Sorry, I don't know if that was talking about.
Other questions? Seeing none, thank you for your testimony.
Thank you. Appreciate that.
We welcome the next representative from the Department of Health and Human Services. Welcome.
Make sure I give you the right division. Good afternoon, Senator Clements, members of the Appropriations Committee. My name is Tony Green, Tonygreen, and I'm the Director of the Division of Developmental Disabilities within the Department of Health and Human Services. I'm here to testify in support of the Governor's Budget Recommendation LB 814, which will appropriate funds for Developmental Disabilities Aid. The Governor's Budget Recommendation includes funding in Developmental Disability Aid for services of people designated as Priority 1 individuals and new graduates. Priority 1 offers are to fund services for individuals that are in immediate crisis. The budget recommendation includes funding for approximately 40 individuals in this designation per fiscal year. The new graduate offers fund services who are transitioning, for students transitioning out of the K through 12 educational system at the age of 21. And the budget recommendation includes approximately 144 individuals in this designation per fiscal year. The governor's recommendation also includes funding in fiscal year 25 for the 15% provider rate increases enacted as part of LB 1011 in 2022. The total cost of these increases was $26.4 million in state general funds per fiscal year. LB 1011 provided $6.9 million in state general funds, while DHHS utilized current appropriations to fund the remaining $19.5 million in fiscal year 23. In agreement with the governor's recommendation, the department believes current appropriations are again sufficient to cover the $19.5 million in fiscal year 24, while then incorporating the $19.5 million into the DDA base appropriations starting in fiscal year 25. The governor's recommendation does not include the department's request to increase appropriations to allow the department to offer more individuals from the DD registry for the home and community-based services. However, in agreement with the governor's recommendation, the department also believes current appropriations are sufficient to cover services for the 250 individuals that we would be offering off of the registry per fiscal year. In summary, DHHS supports the governor's budget recommendation LB 814, which provides the necessary resources to serve Nebraska's developmentally disabled population. Respectfully request the committee support this recommendation as well, and I'm happy to answer any questions you might have.
Further questions from the committee? Senator Dorn.
Thank you, Senator Clemens. Thank you, Director Green, for being here. The DDD registry for the home, and it says you'll be able to help 250 individuals offer services. How long is the list?
The list is 2,300 right now.
Other questions? Seeing none? Thank you for your testimony. And are there, is there going to be another agency division?
I am the other agency as
you
well. Can you do a quick wardrobe change, or if you want to go right into that one?
Yes, we'd like to do all of the agency representatives first.
Perfect.
Then we'll ask for other testimony.
All right, good afternoon again, Senator Clements and members of the Appropriations Committee. I'm Tony Green, T-O-N-Y-G-R-E-E-N, and I am the interim director for the Division of Behavioral Health within the Department of Health and Human Services. And I'm here to testify in support of the governor's budget recommendation, LB 814. The governor's budget recommendation includes a general fund appropriation for the 988 Suicide and Crisis Line Call Center. Beginning in July 2022, nationwide use of a 3-digit code for persons to access behavioral health assistance and referrals began operation. This vital resource is available 24/7 for calls, texts, and chats by person experiencing suicidal ideation, substance use, mental health crisis, or any kind of emotional distress. The primary goal of the Lifeline is to provide support in the moment when it is most needed, as well as connect the caller with follow-up services and supports, including 911 or mobile crisis response teams in the caller's area. DHHS worked with Boys Town to fund the first year of the statewide call center using carryover funds and a time-limited federal grant. The appropriation request in the budget recommendation will establish the ongoing funding for the operations of the call center. The governor's recommendation also includes a general fund appropriation to restore an offsetting reduction that was enacted in fiscal year 23 while using carryover funding to support a provider rate increase. The proposed recommendation would replace the $6.1 million reduced in fiscal year 23 and restore Program 038 Behavioral Health Aid to the previous base amount, thus ensuring funding is available to meet the behavioral health needs across the state. Finally, the department implemented the fiscal year 23 rate increase of 17% in July 2022. In agreement with the governor's budget recommendation, the department believes current appropriations are sufficient to cover these costs. In summary, the governor's budget recommendation in LB 814 will ensure that the 988 Suicide and Crisis Line Call Center and other important behavioral health services are available for Nebraskans. I respectfully request that the committee support the governor's budget recommendation, and I'm happy to answer any questions.
Other questions from the committee? Senator Dorn.
Oh, thank you, Senator Clemens. Sorry. Thank you for being here again.
Sure.
I don't know about the fourth paragraph at the bottom there. It says the department implemented the FY '23 rate increase of 17% in July 2022. In agreement with the governor's budget recommendation, the department believes current appropriations are sufficient to cover these costs. Could you explain that, how that will work in this next budget cycle, that those funds will then be used for that, or do we need to reappropriate them?
Should maybe ask that again, Senator. I'm sorry.
Okay, yeah. It's about the fourth paragraph from the bottom, which
Okay.
is in your thing here. It says that Department implemented the 23 rate increase of 17% in July 2022. In agreement with the governor's budget recommendation, the department believes current appropriations are sufficient to cover these costs. Is that sufficient? I guess I'll ask it this way. Sufficient to cover it going forward in this budget that we're going to come about now? Those funds will be there to still implement that increase, or where does that all lie? I guess. Explain that.
Okay, thanks for clarifying. So my comment is that we believe in the current biennium that there is sufficient. As you know, things are drastically changing in these budget at HHS, especially as you heard yesterday from Director Bagley in Medicaid. And that certainly has a great impact on us in behavioral health, as well as people perhaps moved off of Medicaid during expansion. And now we're kind of waiting to see what that unwinding or the return of some of those folks perhaps back to a regional funded system. So I think it's safe to say, with the amount of funding that we're looking at today is being unspent, based on the volume we have today, we believe we will have enough to fund those increases through this biennium, and we'll continue to watch what happens with the population with some of these moving parts.
But this is like, okay, thank you.
Senator Armendariz.
Thank you. And I think I might have asked this several weeks ago, but how does the hotline work with the Boys Town hotline? How do they differ, and does Boys Town still have one?
So it's actually now integrated in the call center. And so we've combined kind of the family helpline at 988 and calls are routed into Boys Town.
Okay, so does Boys Town still fund part of that, or with their private donors, or is it completely state funded?
I would have to actually check that fact.
Okay.
I'm not sure if it's fully funded by the department.
Are there other questions? Senator Erdman.
Thank you, Senator Clemens. Thank you for being here. So this 988 number, how does that get advertised, what it does?
Yeah, so the department certainly has been engaging in some advertising efforts. Federally, they also are promoting the 988. Again, it went live in July. We recently just signed some contracts for some marketing of the 988 line itself. It has been growing month over month. So we're averaging today in January about 51 calls per day are coming into that line for 988, but we are dedicating resources to market.
Will that line work anywhere in Nebraska?
Yeah, so the 988 line really comes into the federal level, and then it is dispersed out to the states, and each state has their own call center then that routes those calls. There's a backup system so that if a local state's call center doesn't have capacity at that moment to answer that call, it gets rerouted back up to the national line and then diverted to ensure that someone always will pick up that line.
I'd never heard of 988 before. Okay. So you got a lot of work to
We have to do some work.
Thank
Are there other questions? I have one comment from the fiscal analyst. The fiscal year 23 was offset by using $16.5 million of unexpended balance in the program. And the comment here, this is on page 53 of the governor's of the LFO budget book. The offsetting reduction is considered one time and does not affect the base amount for the behavioral health aid going into the next biennium. So
Thank you.
we did not consider that a reduction. Thank you. All right. Thank you for your testimony. Now we'll welcome anyone who would care to testify regarding DHHS budget, the developmental disabilities, public health, or behavioral health.
Good afternoon, Senator Clements and members of the Appropriation Committee. My name is Kathy Seacrest, Kathyseacrest. I'm the Regional Administrator for 17 counties in Southwest Nebraska. I'm also distributing testimony from Holly Brandt, who's the Administrator in Region 1, which is in the Panhandle, your areas. So, we're supportive of the Division of Behavioral Health's initial budget request, which would have included the $10.3 million in the initial request to maintain the balance of funds in behavioral health. You have heard about our challenges with drawing down all funds. Historically, we have always drawn down every dollar that we could. However, the combined impact of several factors, COVID, workforce challenges, Medicaid expansion, lack of flexibility to move dollars where they are needed and can be spent, and ending expense-based services has resulted in the unspent funds. For example, in fiscal year 16, Region 2 drew down 110% of our funds, and we have been at or around 100% in fiscal years 17, 18, and 19. We only began to experience these challenges with drawdown in the fiscal year 2020. We knew that we would face challenges with Medicaid expansion, and we communicated our concerns to the Division of Behavioral Health. Region 2 tried to implement innovative ideas and programs to prevent this lack of drawdown from happening, but we were met with resistance from the division. And on one project, our plan took 14 months to be approved. The rate increases were most welcome, but with workforce shortage and the rigidity of the division, we could not make our big projects happen. The needs are apparent to all of us. The world has changed, and Nebraska's behavioral health program has not. Please consider appropriating the leftover dollars so that we keep the funding needed to serve all Nebraskans. It may take time to right the system, but with dollars and flexibility, we are confident we can create a system that provides the care needed by all those in need. Appreciate your time. Happy to answer any questions you might have.
Other questions? Seeing none, thank you.
Thank you, Senator.
Next testifier, welcome.
Thank you. Good afternoon, Chairman Clements and members of the Appropriations Committee. My name is Beth Baxter, B-E-T-H-B-A-X-T-E-R, and I'm the administrator for Region 3 Behavioral Health Services that covers the counties in 22 counties in South and South Central Nebraska. I'm here today on behalf of the Nebraska Association of Regional Administrators and the Region 3 Governing Board. First of all, I want to say thank you for your support of behavioral health, including the current allocation of $10.3 million for provider rate increases that were so desperately needed to help address circumstances that have placed the behavioral health system at risk of losing services. The regional behavioral health authorities have been the structure for the public behavioral health services across Nebraska since 1974. For almost 50 years, we've served as the safety net for Nebraskans who are uninsured, underinsured, and experience complex mental health and substance use disorders. Our networks of community-based providers and coalitions, community coalitions provide a comprehensive array of treatment, rehabilitation, support, and prevention services that touch all 93 counties of Nebraska. I provided a map of the regions and an org chart just for your reference. One of the concerns you've heard over the past few months is that the regions are not drawing down their contract funds with the Department of Health and Human Services. The chart on your handout just provides a snapshot of the last 8 years for Region 3, our drawdown history. 5 of those years, our drawdown was very high. It's the last 3 years that trend has changed. COVID-19 restrictions impacted capacity, forcing our residential providers to move from double occupancy rooms to single occupancy rooms, which in essence cut their capacity in half. Due to the lack of flexibility to move funds between rate-based services and expense-based services, we were unable to assist the Crisis Stabilization Unit with their increased costs of food, utilities, supplies, and insurance, even though we had the funds to do so. Providers have experienced workforce shortages that have reduced capacity and their ability to draw down funds. They're optimistic that this is going to turn around. In fact, on Monday, I was visiting with one of our providers, and for the first time since the pandemic, they have only one open position to fill. Over the past year, Nebraska has invested $50 million in initiatives to address the behavioral health workforce shortage. $40 million of ARPA funds were appropriated to the Behavioral Health Education Center of Nebraska to grant to entities to address the workforce shortage. Additionally, through the $10.3 million carryover, our system was able to increase provider rates by 15% that was targeted towards workforce recruitment and retention. As the workforce shortage improves, I'm afraid that there will be no funds for us to be able to return to the pre-COVID capacity if that $10.3 million is cut out of behavioral health aid. In addition, there will be challenges in meeting the demand of approximately 20% of individuals who are Medicaid eligible through the expansion process, who will now lose their eligibility through the unwinding process. These individuals will return to the regional behavioral health system, and we need to ensure that we have the capacity and the ability to meet their needs. Thank you for your time today, and I'm happy to answer any questions.
Any questions? Senator Lippincott?
You're the regional administrator for 22 different counties. That's a lot. Big. In fact, it includes my area. Approximately how many people do you tap into your services during a month? And while you're thinking of that answer, I've talked to a lot of sheriffs in our area, a lot of state patrolmen, and they say that behavioral health services is the one thing that we really, really need.
And I would agree with them. I'm not sure on the monthly, but in any given year, we serve in excess of over 5,000 individuals, and they have multiple encounters. Individuals come into the behavioral health system generally with not just one need, but they have complex needs. So that means that they generally are in several different services at a time. Mm-hmm. And so that 5,000 people really plays out to be about 10,000 across various services.
Mm-hmm. Is that just in your district?
Yes,
or is
that's
that statewide?
just it. No,
it's
that's
ours.
Probably statewide. I think we serve between 25 and 30,000 individuals.
Goodness. Thank you.
Senator.
Thank you, Senator Clemens. So you have 6 regions,
Yes.
$10.3 million. How is that distributed? By population? Or?
Yes. It's a per capita basis.
And what is your percentage, you know?
It's probably about 13%. The loss of that $10.3 million, that equals a $1.5 million cut to Region 3. And then also we will lose $120,000 of county tax match. So for just Region 3 alone, that's almost $1.7 million.
Okay, thank you.
Other questions? Seeing none, thank you for your testimony. Next testifier. Welcome.
Thank you. Good afternoon, Chair Clements and members of the Appropriations Committee. My name is Patrick Kreifels, Patrick-Kreifels, and I am the Administrator for Region 5 Systems Behavioral Health Authority. I'm here today on behalf of the Nebraska Association of Regional Administrators and on behalf of the Region 5 Systems Governing Board. Region 5 is comprised of 16 counties in southeast Nebraska, including Butler, Fillmore, Gage, Jefferson, Johnson, Lancaster, Nemaha, Otoe, Pawnee, Polk, Richardson, Saline, Saunders, Seward, Bayard, and York. I want to begin by offering my profound appreciation to the senators and governor for your contributions to our state. Thank you for your service. I'm here today to respectfully ask for your support for maintaining the balance of money in the behavioral health by maintaining the Division of Behavioral Health budget request, investing in the behavioral health system for the well-being and recovery of vulnerable youth, families, and adults in Nebraska. The director of the Division of Behavioral Health included in their budget request the $10.3 million to sustain the 15% provider rate increases, prioritizing the impact of these funds to support a recovery-oriented public behavioral health system and safety net for the most vulnerable citizens of Nebraska, adults and youth. Governor Pillen's proposed budget removed the $10.3 million, articulating the rate increase could be absorbed by existing funds within the regional behavioral health budgets. While funding the rate increase to providers with existing funds is feasible, this will result in cuts in other areas and will have a dramatic effect on the future behavioral health services within Nebraska. The impact alone to Region 5 systems is a loss of approximately $2.4 million in state funds and county match funds of $346,000 for a total of $2.7 million per year. The loss of funds to Region 5 systems will result in the following activities no longer being initiated or sustained: expanding capacity in outpatient services for adults and youth, halfway house for women with substance use, initiating same-day risk assessments for people presenting with suicide ideation, mental health interventions in public schools, forensic peer support services for people in jail settings, Bridger services helping people in state hospitals successfully integrate back into the community, traditional and reverse behavioral health and primary care integration in rural settings. The challenges have been real and have resulted in funds not being drawn down for some of the regions the last 3 years. And those challenges are Medicaid expansion. More people have been utilizing and drawing down Medicaid and not using regional funds. COVID-19 with a public health emergency didn't allow people to be removed from Medicaid. Therefore, the regions were in constant flux, not knowing when that was going to be lifted, and we were going to have to fund the people needing our services again. The decreased capacity, as you heard before, providers had to spread out people so that they decreased the spread of COVID, and a lack of workforce and supplies for expansion of services. Rigidity of funding, the Division of Behavioral Health has been trying to mirror the regional behavioral health flexible funding to be similar to Medicaid, which our funds are to be more flexible in that public safety net. And there has been a slow response from the Division of Behavioral Health in regards to proposals. Region 5 submitted over 18 proposals in the last year and a half, and there was an average of 78 days slow response, and up to 288 days was the longest response it took to get resolution to our proposals. The American Rescue Program Act funds also flooded the system, and thereby some providers were using those funds versus the funds that were available in the behavioral health system. The regions are requesting more time to methodically and systematically realign the behavioral health system to support the needs existing. While the funds in our system have not been utilized, they are obligated for future services during this realignment phase. I thank you for your time and ask for the allocation of the 10.3 to be put back in the budget. I'm here to answer any questions you may have.
Are there questions? Senator Armendariz.
Thank you. Thank you. I'm trying to follow all of the different things that are falling out of place, that you can't recoup the funds that you do have available to spread across this deficiency that you say you have. So you need the $10 million to keep the rates, the provider rates up. But the governor thinks that you can provide that through funds you already have, but they're locked up somehow.
That's right, Senator.
Is that through HHS
Well,
being slow to respond, or?
so the funds, there is a lack of drawdown that we have had over the last 3 years, and it's for some of those factors: the slow response, the lack of flexibility in adjusting within our own budgets, and if we're not able to move those funds into the community, which we heard there is a need from the constituents in our region anyway. It is a challenge for us to kind of move those forward. So having those available to us so that we can realign the system and get them out in the community and services is really our priority.
So if you had that taken care of, you would stay whole.
If we could maintain the balance with the 10.3 back in, it will help us bring up future services and meet the needs more readily in the community.
And you also have those available, they're just tied up.
They are tied up, and there's been an inflexibility in trying to move them out.
And so since COVID has died down, have you reintegrated the 2-person rooms?
The providers are all at full capacity at this time, yes.
Okay, so that would help alleviate
It does
the cost
also,
as well.
yes.
Okay, so the biggest issue is we need to figure out how to free up the flexibility in moving the funds around.
More flexibility
Okay.
is warranted and would be appreciated.
Thank you.
Thank you.
Other questions? Senator Erdman?
Thank you, Senator Clemens. Thank you for coming. Can you explain the county match? How do you get about that? Is it a percentage is what the state matches?
There are a certain percentage of what the state gives us for behavioral and mental health. There's a statute that came out of 1083, and each one of the counties in each one of the regions, they have to match a certain percentage of that. It's about 40% approximately. And so with the decrease of the 10.3 million, and for us, the 2.4, it will decrease the match and lose funds available to the people for services in our community.
Thank you. Further questions? Seeing none, thank you for your testimony.
Thank you. I appreciate your time.
Next testifier. Welcome.
Good afternoon, Chairman Clements and members of the Appropriations Committee. My name is Ingrid Gansebaum, INGRIDGANSEBOM. I am the Regional Administrator with Region 4 Behavioral Health System, which covers 22 counties in North and North Central Nebraska. I would like to thank you for your past and continuing support for behavioral health in Nebraska. We truly appreciate the 15% rate increase last year, which has helped providers throughout the state providing mental health and substance use services. Prior to 2020, in fiscal years 2017 to 2020, Region 4 has consistently utilized contracted funds in excess of 96%, with the highest utilization being 100%. Multiple factors have impacted our drawdown since, as we have had a utilization rate of 81.8% in fiscal year 21 and 73.7% in fiscal year 22. An example of factors that have impacted the lower utilization rate include a situation where one of our providers had been awarded a contract for a crisis stabilization program, medically monitored withdrawal management program, dual diagnosis program. We had worked with the provider for 2 years to move forward on the program, but with workforce, renovation, supply chain, and pandemic changes, they have indicated that they cannot implement these programs. In the coming months, we will be putting out a new request for proposal to implement the programs with a new provider. As the funds for these programs have been allocated, Region 4 cannot spend them in any other manner. 2 other providers, one a dual diagnosis program and another psychiatric rehabilitation provider, were unable to continue their current programs, which they had had for many, many years due to workforce. Because the funds in these programs had been allocated, Region 4 could not spend them in another manner. Region 4, along with other regions, have had difficulty obtaining approval with new services that fall outside the current service definitions. Region 4 works with local stakeholders, including probation, hospitals, law enforcement, child and family services, providers, and consumers to determine the needs that will improve our local system. While our collaborative efforts have resulted in new and innovative ideas, the process for getting those approved is inefficient, time-consuming, and often results in the ideas being denied. The result is dollars being unspent, and more importantly, individuals not getting the services they need. We have developed a list of new services that we would like to move forward with. I have attached the list to my testimony. These suggestions come directly from conversations surrounding gaps and needs in Region 4. We will not be able to make these services come to fruition if the $10.3 million is not maintained to balance the behavioral health aid budget and allocated to the regions. Thank you for your time this afternoon and your consideration of our request, and I would be happy to answer any questions.
Other questions from the committee? I have a
Yes.
message, a note here I'd like you to
Sure.
respond to. In LB 1011 in 2022, the Appropriations Committee added language to allow flexibility to move funding between line items to provide for more flexibility. And my analyst says DHHS has been slow in adopting that. Is that what you have found?
Yes, I would agree to that. We, in prior years, we were able to shift dollars in between service lines, and we could do that without getting authorization, and then we just, would be able to obviously let the division know. Since in the last few years, we could do it basically 4 times a year. They do have emergency shifts that we can also do, but it is more difficult than in the past. It's extremely difficult going from a unit-based shift to expense reimbursement shift. That's just really difficult to get done. Yes.
All right, thank you for the clarification.
Mhm.
Senator Erdman?
Thank you, Senator Clemens. Thank you for coming. So what is your
Yes.
portion of the 10.3 million?
1.3 million,
1.3?
Yes.
And your county share?
probably about 100,000 for that.
Thank you.
Mhm.
Other questions? Seeing none, thank you for your
Thank you.
testimony.
Thank you very much. Have a
Are
good
there
day.
additional testifiers? All right. Good afternoon.
Good afternoon, Chairman Clements and members of the committee. My name is Patty Jurjevich, P-A-T-T-I-J-U-R-J-E-V-I-C-H. I'm the administrator for Region 6 Behavioral Health Care that includes Cass, Dodge, Douglas, Sarpy, and Washington counties. I'm here today on behalf of the Nebraska Association of Regional Administrators. I also want to thank the committee for its past support as well as for the $10.3 million appropriation to cover that 15% rate increase that we received this fiscal year. Today, you've heard from the other regional administrators about the long history of strong utilization of the funds appropriated to our system by this committee. You've also heard about the specific issues over the last 2 years that have contributed to the lower drawdown of funds. That's COVID and the loss of capacity and workforce, delays in approval for budget adjustments and new service development, and reimbursement methods that restrict innovation and endanger access, especially in rural areas. Another factor, Medicaid expansion, provided a rare opportunity for regions to reevaluate needs and gaps in their communities in order to invest these available dollars to expand and develop new services. Clearly, the issues previously identified impacted the pace with which expansion and development could occur. While these new activities may be at varying stages of implementation, I want to emphasize that funds in the region's FY23 budgets have been obligated to fully fund these programs and projects. An unknown for us is Medicaid unwinding. In this eligibility redetermination process, it is projected that a 20% shift from Medicaid coverage to regions' behavioral health funding will occur. This anticipated funding shift between systems creates uncertainty as to how much in additional costs we will see in the FY24 and FY25 budgets. The $10.3 million reduction to behavioral health aid that we face in FY24 will jeopardize the future of planned activities. I request your support by maintaining the funding balance with the $10,305,951 in behavioral health aid. Our system needs more time with no loss in funding to respond to the setbacks we've discussed. I would encourage this committee to include language identical or similar to the provisions of LB 433 that is in the Health and Human Services Committee. That bill, as introduced, would provide budget flexibility for regions to meet needs. It requires that any appropriation to the regions via the Division of Behavioral Health be allowed to be used within the approved annual budgets or by activities identified through need as demonstrated by the region throughout the year. It will allow the region to move up to 20% within a service category to address emerging needs. This is language that is similar to what was originally included as intent language in the FY22-23 budget that has been ignored by the Division of Behavioral Health. There has been no reduction in the demand for behavioral health services. Our community-based service providers have done an amazing job to meet that demand, and regional administrators have strongly advocated with DHHS to eliminate barriers. To conclude, the regional behavioral health authorities envision a system that is accessible, effective, efficient, innovative, and flexible to meet the current and emerging behavioral health needs of Nebraskans. As always, we appreciate your continued support of the behavioral health system. Thank you for your time, and I will try to answer any questions.
Other questions from the committee? Senator Erdman?
Thank you, Senator Clements. I'll ask a similar question. So it appears on that third page, your loss may be 3.4 million.
3.5. Mm-hmm.
What's your county match, do you know?
That would be probably another close to 400,000.
400? Thank you.
Other questions? Seeing none. Thank you for your testimony.
Thank you very much.
Welcome.
Thank you. Good afternoon. I'm Chairman Clemens and a member of Appropriations Committee. My name is Natalia Young. It's NATALYAYOUNG. And I'm the Executive Director at St. Monica's, located here in Lincoln, Nebraska. Within Region 5, we service Region 2 and Region 5 service area. Sorry, just a little nervous. I've not done this. I want to start with thanking you for your commitment, sacrifices, and contributions to our state, ultimately helping make Nebraska a great place to live. The past 16 years, I have seen a large support from Region 5 state funds to St. Monica's program services, but there has been a significant change in the regional behavioral health drawdown since Medicaid expansion in October of 2020. Prior to Medicaid expansion, St. Monica's monthly billing to the regions was an average 70%. Currently, our monthly billing to the regions is an average 5%. With the upcoming unwind, our concern is that there will be an increase of our clients without Medicaid and will need the assistance of the state behavioral health aid funds. In May of 2022, St. Monica submitted a request for proposal to Region 5 for a licensed halfway house, a 3.1 level of care for women. This service is currently unavailable for women in Lincoln and Nebraska. St. Monica's had a current location that could be used for the halfway house. The hope was to open the program in January of 2023 after minor renovations. Unfortunately, opening has been delayed due to the request for zoning permit change, renovations doubling from $120,000 from $60,000. Obtaining renovation funds and delays in a building permit included on a separate sheet of a timeline of events is attached to my testimony. St. Monica is hopeful to have the building permit in hand this week of March 25th. With all of this said, St. Monica's has been able to open the halfway house and serve women currently waiting for services. The hopes for opening the services, like I said, was in January and has been moved back to potentially May 1st of this year. St. Monica's fiscal year 22-23 budget for Region 5 halfway house services was $407,000 for 6 months. We hope to partially draw down these funds in May and June if no other delays occur that are out of our hands as a provider.
Region 5 has been supportive of St. Monica's through the delays that we have encountered. I would say that these setbacks are not uncommon with inflation and workforce shortages for many organizations. In closing, I have 2 requests. First, I would request that the funds of the $10.3 million be maintained in the behavioral health aid budget. There will be a change in participants' eligibility of Medicaid benefits and will need state funds for services the regions provide. Second, I would request a time frame of a year for providers to plan service programs once a request for proposal has been awarded. This will allow service providers time to seek adequate funds, space, program structure, and workforce for a new service program. Thank you for your time and allowing me the time to speak to all of you about the challenge that we have faced with opening a new program. And I'm available for any questions.
Are there questions? Senator Erdman?
Thank you, Senator Clements. Thank you for being here. Can you explain the Region 5 halfway house services at $205,000 for 6 months? That's $410,000 a year, $34,000 a month. Is that one facility?
That's one facility, and that is for 6 months.
Yeah, but how many people are there?
12.
There are 12 people housed there?
There would be 12 women there to serve 12 women.
Okay, thank you.
Yep.
Other questions? I had just one little clarification on your billing at 70% reducing to 5%. How is it that happened?
So most of the women that were with St. Monica's for Medicaid eligibility prior to the expansion, they only received Medicaid if their children were residing with them. So then when the expansion changed and it was based on poverty, that made a huge switch. So now almost all of our participants are eligible for Medicaid based on poverty. It wasn't because they had a child within services with them.
Oh, all right.
Yeah.
And then that's what you're saying, that the eligibility is going to change.
Yep, with the unwind.
With the unwind, which you think you'll be.
So I don't know that we'll go back to that 70%, but I definitely think there will be a change. And so if that funds aren't there for those individuals, you have a lot of people that are without services. And that is the service population that we serve, is the underserved women in Nebraska.
So the region provides you supplemental funds when you're serving uninsured.
Yeah, so if they're Medicaid eligible and they drop off, then they are eligible for Region 5 or probation, depending on what they have. But everybody's the payer of last resort.
All right. Just needed that clarification. Thank you.
Yes, thank you.
Thank you for your testimony. Next testifier. Welcome.
Good afternoon, Senator Clements and members of the Appropriations Committee. My name is Krista Yoakum, CHRISTAYOAKUM. And I'm appearing before the committee in my capacity as chair of the Lancaster County Board of Commissioners. And in my role as county commissioner, I also sit on the Region 5 Regional Governing Board. I'm here to testify on behalf of the county board in support of the budget for Agency 25, Health and Human Services. Specifically, the county board strongly supports behavioral health aid that flows to the regions. Behavioral health is the epicenter of so much of the work that we do in Lancaster County. The county board repeatedly is briefed on how the jail's adult population is currently at unprecedented highs, how the youth services center's juvenile population has dramatically increased over historical levels, and how the crisis center is constantly at capacity. To tackle these issues, I've attended numerous meetings of advisory committees that include representatives from across the law enforcement, criminal justice, and behavioral health disciplines. The officials who are on the front lines every day. And I have heard the same conclusion from all of them. Our community desperately needs expanded behavioral health services. Given this operational reality being experienced at the county level, Lancaster County recently made historic investments of once-in-a-lifetime American Rescue Plan Act funding into community-based services. The county invested $15 million in capital improvements and revenue replacement for local nonprofits. $5 $5 million for capital improvements to support the development of a family resource center for families in acute crisis, and $2 million toward capital improvements to increase voluntary crisis residential services. The county's investments simply are not enough on their own. Local governments like Lancaster County need state and regional partners to achieve a permanent, sustainable difference. Our local behavioral health region is uniquely positioned to make the most immediate impact in addressing the community's urgent need for behavioral health care by expanding current services and developing new services. Emerging from a pandemic that decreased treatment capacity, decimated the behavioral health care workforce, and changed the face of the regional treatment, Region 5 currently is facing the generational challenge of serving the most vulnerable youth and adults in our community. We urge this committee to provide $10.3 million in funding for behavioral health aid as set forth by the Division of Behavioral Health in last fall's budget recommendations to ensure that all regions and Region 5 have the resources necessary to meet the significant behavioral needs of our growing Lancaster County community. Thank you for the opportunity to testify here and for your services to our great state. I would be happy to answer any questions.
Other questions? Senator Erdman.
Thank you, Senator Clements. Thank you for coming today. On the second page of your testimony, you said you used ARPA money, invested $15 million in capital improvements, and then $5 million for support and development. Is that correct?
Yes.
How much ARPA money did your county get?
I believe we had 69 million.
69? Can you give us a brief overview of what you did with the rest of it?
Yeah, we did put a lot into our nonprofit organizations that we typically fund, that we consistently fund beyond ARPA, right? I gave funding to them for improvements to their buildings and facilities, more of those long-term infrastructure sorts of improvements, not into programming directly because we knew that wouldn't be sustainable.
Can you name some of those?
Yeah, like the Asian Community and Cultural Center, El Centro de las Americas, Community Action, their Head Start program. We did a HVAC system for them there. We also did structural things within our own buildings, our mental health crisis center, some of those.
All right, thank you.
Other questions? Seeing none, thank you.
Thank you.
Next testifier. Good afternoon.
Good afternoon. Just to be clear, I'm going to change you up a little bit, go on DD for a second. So,
all right.
So you can, I like to signal my lane changes so let you know what I'm doing. Chairman Clemens, members of the Appropriations Committee, thank you for this opportunity. My name is Alan Zavodny, ALANZAVODNY, and I'm the Chief Executive Officer for North Star Services, which is 21 counties, Northeast Nebraska. Colfax is opted out, or else we'd be the same as behavioral health. The regions are set up that way. So we started as 22 counties. I provide you bullet points for the DD funding, and because I always come here and tell you I'm not going to say anything I can't prove, I provided documentation of where every single number came from. So page 1 of the packet shows that we were poised to lose more than $1 million last year before the governor made adjustments to our rates from January to June. Page 2 shows our year ended up with $105,022.24 loss, and shows our administrative expense was 9.405%. I've never been so happy to lose $105,000 in my life, considering where we were headed. So you can see it was a struggle for sure. Page 3 of the packet shows that 83.4% of our operating revenue was salary and benefits that go directly to our staff, and that's from our audit. Page 4 shows that our margin is 0.08%, also from our audit. Page 5 shows the department's chart that appropriations have risen, but expenditures of the department decreased. And this, to me, almost seems like a property tax thing. We always talk about, we don't raise levies. I'm going to talk to you about your consumption tax pretty soon because I'm intrigued by that at this point. But values go up, so we keep paying more in property taxes. So you got to tell the whole story when you're talking about those kinds of things. And the remaining pages show what happened with state labor contracts while the state continues to have difficulty hiring. I also wanted to point out that of the ARPA money we received, that we couldn't put that into our salary schedule because we know that's going away in 3 years and it's decreasing every year from the first year. But we kept our promise and 100% went to our staff. What we did is we went on the hours they worked for each time we get it quarterly. We turn around, and if you work almost full time, you get the largest amount. We just take the whole amount, and I came up with a formula to give it out to our staff. To summarize, the increases we got have kept us solvent. That's absolutely true. Our ask is really to get us to zero. Just make sure our revenues versus our expenditures that we can afford to keep operating. We've had some success in retaining employees, but recruitment did not improve. And my OCD would tell you that TOSIC was TEEOSA instead of how I have it there, so fix that. We also need to consider changing into something that builds in some kind of a metric so increases can happen. I've been doing this 42 years. I have more yesterdays behind me than tomorrows. I know that, and certainly in my work life. So don't throw money at this. I've always said in good years, we always want to give, taxes back to the citizens, which is great, and we should do. And in bad years, we can't afford it. So it's never a good year to fund these things. We just ask that you keep providers stable. The state really doesn't want to take this over. It'd be very expensive. And we are doing what you're obligated to do. We, for all intents and purposes, just exist to do the work that you are obligated to do. If a nursing home closes, you're not obligated to go put another nursing home in there, but for DD services, you would be obligated to do that. So you are, for all intents and purposes, our only funding source, the state with the federal match. And we support the bills that will be coming up later, and want you to know that we recognize if it doesn't go into your appropriations recommendation, the chances of anything happening, especially this session, are almost none. We gave raises when we didn't have the money to do it because we were between a rock and a hard place. We certainly don't want to be in the position to do that again. So thank you for allowing me to come before you today.
Thank you. Are there questions from the committee? Seeing none, thank you for your testimony. Good afternoon.
Good afternoon. I will also be changing to a different topic. I'll go for the Division of Public Health today. So good afternoon, Chairman Clements, members of the Appropriations Committee. My name is Randy Scott, R-A-N-D-I-S-C-O-T-T. I'm a registered lobbyist appearing on behalf of the Michael J. Fox Foundation for Parkinson's Research in full support of the budget recommendation for the Nebraska Parkinson's Disease Registry through the Division of Public Health. My client wishes to be here today, but she is currently in another state testifying on a registry at their state capital today. The Michael J. Fox Foundation for Parkinson's Research was founded in 2000 and has been singularly dedicated to finding a cure for Parkinson's disease through an aggressively funded research agenda and to ensuring the development of improved therapies for those living with PD today. So Parkinson's is the fastest growing neurological disease in the world, with 90,000 people being diagnosed each year, and the number of people with PD is expected to double by 2040. The annual cost of Parkinson's nationally is at least $52 billion, and that will rise to about $80 billion by 2037. Established in 1996, though, Nebraska became the first state in the country to create a Parkinson's disease registry. So ours is a legacy program that has the potential to be at the forefront of patient population data collection, with this infusion of funding to take this program from paper to real-time electronic data collecting and reporting to be first in class in the nation. And we are very excited about the possibilities for that. Currently, there are 7 other states considering legislation to start a Parkinson's registry during this legislative session. Registry data collected would provide insight into Parkinson's clusters in the state, and that would enable greater scientific understanding of exposure of firefighters, other first responders to chemicals, toxins, heavy metals, and other possible environmental factors that could be Parkinson's triggers. So we hope that you will support this appropriation and allow the registry to grow and become the best in the country. Thank you, and I will take any questions you may have.
Other questions? Seeing none, thank you for your testimony. Are there additional testifiers regarding Department of Health and Human Services? Seeing none, we have position comments for the record. We have one proponent. That will conclude the hearing for Agency 25. We will now open a hearing for LB 362, Senator Dorn. Give us a minute to clear the room and switch our notebooks. All right, welcome, Senator Dorn.
Thank you. Thank you, Senator Clemens and members of the Appropriation Committee. My name is Myron Dorn, M-Y-R-O-N-D-O-R-N, and I represent Legislative District 30, covering Gage County and southeastern Lancaster County, Nebraska. I am here today to open on LB 362, which continues our efforts to increase mental health and substance use treatment provider rates by 5%. LB 362 seeks to increase these rates in Medicaid, the Children's Health Insurance Program, Behavioral Health Aid, and Juvenile Justice Programs. This committee worked together last year when there was a desperate cry for increases for these providers because of the impact of COVID pandemic and the resulting mental health crisis and need to expand services and increase workforce. Behavioral health providers were very appreciative of these increases, and frankly, they saved many facilities from closing their doors. We should be proud of how the increase in rates for these providers made a significant difference in the lives of many Nebraskans. I want to tell you about one provider in my district, Blue Valley Behavioral Health, which has been able to increase the accessibility of mental health and substance abuse services in 16 counties in southeastern Nebraska, including my district this past year. Additional fundings went directly to salary increases for all the staff, along with covering the increased expense of health insurance and other related benefits cost. So what we did last year, decreased threats to staff retention, managed the high demand and low supply of behavioral health professionals. Continued stabilization of behavioral health services in Nebraska must be our focus so that we do not get too far behind again. In 2018, the most recent DHHS department study showed that the difference between rates and determination of what the key services actually cost providers was between 18 and 52% below the cost of providing services. Although we hope rate increases approved by the legislature since 2018 have caught us up with some of these costs, each year inflation increased costs like rent, utility, and wages. COVID-19 didn't help at all, and our current 6% inflation rate, which is actually 7.87%, has just been adding to the problem. This is a big picture summary, and certainly some rates are better than others in each of these systems included in LB 362. But we know that since behavioral health has been significantly more reliant on public payers because of lack of coverage in the private insurance system over the past 40 years, we can come to a reasonable conclusion with the data available. We have a choice to make, continue to invest in a very important system of care that has a proven track record of saving money in the long run and saving lives, or fall back into complacency that we have done enough. Thank you. I'll be available for questions.
Are there questions? Seeing none, will you be here to close? I assume. We welcome proponents for LB 362. Good afternoon.
Good afternoon, Senator Clemens, Appropriations Committee. My name is Chase Francel, C-H-A-S-E-F-R-A-N-C-L. I'm testifying today on behalf of the Nebraska Association for Behavioral Health Organizations in support of LB 362. I serve as the president and CEO of Mid-Plains Center for Behavioral Healthcare Services located in Grand Island. We have served Grand Island and the surrounding areas for more than 50 years and provide an array of services, including outpatient and home-based counseling programs, medication management, transportation, youth crisis assessment, and crisis stabilization services. We employ about 70 staff and have served about 3,200 Nebraskans across the Medicaid, probation, Division of Behavioral Health, and private payer networks in the last year. I want to begin by thanking Senator Dorn for introducing LB 362 into this committee for its support for behavioral health systems over the last several years. We recognize there are a lot of good causes competing for state funds right now, but few that I know that have such a profound impact on the most vulnerable Nebraskans that we have. And particularly as the need for behavioral health services has increased from about 1 in 5 Americans to 1 in 3 post-pandemic. I also want to acknowledge what a lifeline last season's rate increase was and affirm that it was absolutely crucial in supporting agencies like ours who are struggling to get our heads back above water and meet the new challenges that emerged over the past 3 years. As a committee, you know full well how inflation and rising costs continue to challenge the sustainability of services, and our sector is certainly no different. The focus of my testimony today is going to be on the staffing challenges and the resulting access limitations, the insufficient funding in the public payer systems creating within Nebraska's behavioral health system today. I hope to also frame for you what I think are often overlooked impacts when we fail to invest in behavioral health services at a level that allows us to meet the need as it exists. As a human services agency, the only way that we're able to meet our mission to strengthen and support the wellness and recovery of our communities is through person-to-person efforts of our workforce directly engaging with those in need. For Mid-Plains Center, that means roughly 85% of our nearly $4.5 million budget goes directly to personnel and personnel-related expenses, and that number continues to grow. From this same time last year, salaries at our agency have increased by 10% across the board, with every position receiving at least one pay increase in the last 6 months. In an effort to bolster recruitment and retention, we began offering referral bonuses, hiring bonuses, increased vacation time, and this past January, we increased our employee health insurance benefits and now cover 75% of any employee health insurance plan, an expense that increased nearly $50,000 from last year, and we're being told to anticipate another 9 to 17% increase in this year. We certainly count it a privilege to provide for our employees, but 84% of our income comes from these public payer sources, such as Medicaid, probation, and the regions. So the reality is that our ability to sustain staffing and provide care to our clients is directly tied to the decision on LB 362 facing this committee today. The investment that we're asking you to make will be a decisive factor that will allow us to meet these and other needs that have emerged out of the challenges of the past 3 years in particular. And I want to share just 2 of these examples with you. When I began my role at Mid-Plains Center last fall, our outpatient therapy waitlist had an excess of 100 individuals who were requesting services, most of whom had been languishing on that waitlist for 3 to 4 months and some as long as 6 months. With only 5 outpatient therapists on our team, we committed ourselves to the recruitment of additional therapists to meet this need. And despite our efforts, the unfortunate reality is we've been unable to add even a single new therapist to any of our therapy teams. And the few applicants we've had have not been able to accept the pay that coming to work for a nonprofit such as ours would have required. And at the same time, we continue to see the need for our services continue to explode. Within our youth crisis assessment program, students and youth who express self-harm or suicidal thoughts have immediate access 24/7 to a counselor for evaluation, referral, and safety planning. And while we'd seen and felt the need for this service increasing, at a recent meeting, Hall County Probation reported what to me was a staggering statistic. In just a 2-month period from December 15th to February 15th, Grand Island Public Schools alone referred 174 students for assessment of or services due to suicidal ideation. That's more than 22 kids per week and more than 3 kids per day. And I don't think that accounts for 2 weeks off of Christmas break. This has really increased the toll on our therapists and has really quickly maxed out available services for families and youth. Instead, kids and parents end up on wait lists like ours, hoping that services can arrive before it's too late. And the sad reality is that agencies like ours aren't able to hire staff and build programs that respond to how youth and family needs occur. I fear for the immediate toll it places on our schools and communities today, only to be multiplied into an already taxed adult system in the future. I'll close with this, is that simply put, our ability to hire, train, and retain quality staff is the single largest factor in our ability to meet our obligation to the community. Without it, individuals will not have available to them the treatment they need to achieve being fully healthy and engaged members in our communities. But our ability to hire, train, and retain staff and programs depends on the rates we receive from the public payer system and for what you decide on LB 362. So today I support LB 362's request for 5% and ask you to stand with providers and with our communities in supporting it as well. Thank you.
Other questions from the committee? Senator Lippincott?
What kind of problems do you see amongst your employees, the people that work for your agency?
Right, thank you. I'd say the most concerning one to me, particularly with our clinical staff, our therapeutic staff, which make up the bulk of our programs, is the toll that it takes to provide things like the 24/7 assistance that's just required right now with the needs that we have. That continual burnout, the need and the demand that they want to meet. They're in this field because they want to help people, but the demand is so great and the help is so little that it's really hard for them to sustain that. That's my biggest challenge right now.
Are you able to keep adequately staffed?
No, not in our clinical staff. Our support staff, we've done well. The conversations we've been having is how we can find ways to meet these needs with non-clinical staff, with associate's level or bachelor's level staff, because we just can't find the clinical staff to hire. And to piggyback off previous comments, really the only ones who have the flexibility to be able to pay for services like that in a meaningful way or help us as we create those is through the regions. Payers like Medicaid just don't have that kind of flexibility.
How can that be fixed? Is it a money issue or what is it?
I think there's been some good steps with the ARPA funds and trying to help support the training, the internships, different things like that that agencies can take on. For us, where we see is a lot of folks have moved to private pay. They've moved to doing online counseling only. That's more of a nationwide pool. It just makes it really challenging to be able to hire against. We're hiring against hospitals in a lot of cases, and we just can't compete as non-for-profits in a lot of those cases. We've got to really try to delve in and align well with our mission and support our staff at a whole nother level.
Additionally, how do you interact with the probationary people?
So we provide outpatient counseling. We provide groups at the probation reporting centers. Probation's a terrific partner for us. They understand what the challenges are. They're experiencing them too with their folks. So we operate with closely with District 9 and District 10 probation. That they're a great partner. But it's certainly that's a challenging population to work with as well.
Senator Wishart.
Well, thank you for being here today on behalf of NAPO. Our fiscal analysts have put together sort of a chart that shows us behavioral health aid from 2014 to 2023 each year. And what we're seeing is that we are appropriating an amount of dollars, but we're consistently seeing an amount that's unexpended. Mm-hmm. Can you help us, and I wish I had been here to talk with the department about this and plan on following up, but can you help us understand from your perspective, we are appropriating dollars, but we're not expending them at the level. What, from your understanding, is that due to?
Right. So a number of factors, and the RAs did share about that previously. I think where that started happening was in 2020. We're all aware of what happened in 2020 and some of the shifts that really hit the capacity for us in terms of how we provided services, what we could draw down, and extremely grateful to the Division of Behavioral Health for their support during that time. At the same time, having the ability to have the workforce to meet the needs. I think a lot of times as agencies, when we're putting in our request, we're seeing the need and what we would like to be able to do, and then the reality changes. Medicaid expansion played a big part in that, not knowing how many we're going to transfer over to that payer system and when. And so that's certainly been a challenge. Beth Baxter commented on the crisis stabilization unit, some of the expenses that we have that they weren't able to fill funds into. I can say when I took over, we had a $500 budget a month for our 12-bed detox facility. Our clients were getting powdered milk because it was the only way to be able to make that available. And so funds were there within the system, but weren't able to be allocated where they needed to be. And I think that speaks to some rigidity that's come into the system, particularly around certain types of funded services, expense reimbursed services over the past several years that has made that challenge more pronounced than certainly it was 10 years ago.
And then one follow-up is, because what I'm hearing is from you is that we are seeing an increase in the amount of population that is needing access to behavioral health, but we are not seeing an increase in the amount of funding that is being spent and invested at the state level, even though our appropriations is increasing.
I think by and large what I've seen is there are a lot more people in the Medicaid system now than are in the regional behavioral health system at this time. I hope that's answering your question, maybe the numbers that you're looking at. We're much more heavily Medicaid funded now than we were even 3 or 4 years ago. That presents unique challenges to agencies, because if I provide and bill a region service, I'm going to get paid for that service. If I do that with a Medicaid service, there are good chances I'm not going to get paid for that entire dollar. That there's denials, there's a lot of hoops to jump through. We've had to add a lot of staff and additional cost to be able to claim those dollars for the work that we still do.
Okay, thank you.
Other questions? Seeing none. Thank you.
Senator Clements.
Next testifier. Proponent, I should say. Welcome.
Thank you. Good afternoon, Chairperson Clements and members of the Appropriations Committee. My name is Katie McLeese Stevenson, spelled Katiemc, capital L-E-E-S-E, Stevenson, S-T-E-P-H-E-N-S-O-N. I'm here testifying in support of LB 362. I serve as Executive Director of Hope Spoke, based here in Lincoln. We provide an array of community-based behavioral health services and have been in operation since 1949. Last year, Hope Spoke served over 1,000 individuals. We are an active member of the Nebraska Association of Behavioral Health Organizations, commonly referred to as NABHO. NABHO has 53 member organizations, large and small, both rural and urban, that comprise our membership, along with consumer groups and hospitals. We are grateful to the Appropriations Committee and to the Legislature for rate increases in the past, especially last year. We appreciate that Senator Dorn has introduced LB 362 to provide a 5% rate increase across payers, including Medicaid, the Division of Behavioral Health, which passes that money through to the 6 behavioral health regions, child welfare, and probation. The 15% rate increase provided last year has been instrumental in helping us reduce the gap between the cost of services and the reimbursement rate. Unfortunately, behavioral health care providers still experience a deficit for each service that we provide, and we are still in the red. We need the help of the Appropriations Committee to respond to the continued extensive needs in communities across the state for quality behavioral health care. The surge that we experienced during the height of the pandemic has not leveled off. For our agency and many others, we have lengthy waiting lists for clients to begin services. Our outpatient waiting list today has increased 128% as compared to prior to the pandemic. We have long waiting lists for all of our programs. When an individual and their family has finally decided that they're ready for help, the last thing that they want to hear is that they're being placed on a waiting list and that their urgent needs cannot be met at this time. The 3 biggest financial issues that we are facing currently are, number 1, the impact of inflation on overall expenses. We've seen record-breaking increases in the cost for food, gasoline, public utilities, and health insurance rates for our staff. Number 2, the impact of the very tight labor market, where we've been unable to fill key clinical positions to meet the community needs for behavioral health care. Despite our best efforts, the wages that we are able to offer are not adequate to attract quality candidates. This has compounded the lengthy wait list for clients to get into services, and at times added to the severity of their needs while they are waiting for treatment. Number 3, the increase in expenses based on raises that have been given to our current workforce. Our costs have increased at a higher rate than the compensation that we receive from our public payers. As we provide more services, the gap widens between our expenses and our revenue. We rely on donors to help us bridge this gap. In the current economy, many foundations have decreased giving or have scaled back the frequency of their funding cycles. Private donors are also concerned about the ability to make charitable donations, or at least the level they have given at previously, making fundraising even more challenging as a means to offset our expenses. We are all aware of the tremendous needs in the communities across our state for quality behavioral health care. As the number of providers who accept payment from Medicaid, the region's child welfare and probation continues to decrease, it's even more vital that those who continue to provide these services be adequately funded. This is the time for those that believe that mental health is important, and I assure you that it is, to act on the belief by supporting the agencies whose providers are serving the most vulnerable children, youth, and adults in our state. Ensuring that individuals have access to mental health care can also improve lives and communities. For many, removing these barriers to mental health treatment can dramatically reduce or eliminate the risk of dropping out of school, unemployment, homelessness, suicide, family conflict, and substance abuse. Without a robust behavioral health care system, the options that will need to be funded will be much more costly to the state, including hospitalizations, detention for youth, incarceration for adults. It's important that people receive community-based services that can help stabilize and support individuals. I urge you to support LB 362 as part of the budget going forward. Thank you so much for your service and for your time today. I'm open to answer any questions that you might have.
Thank you. Are there questions from the committee? Seeing none, thank you for your testimony.
Thank you.
Next proponent for LB 362.
It's me.
Good afternoon.
Good afternoon, Chairman Clements and members of the Appropriations Committee. My name is Beth Baxter, BETH-BAXTER, and I'm here as the Regional Administrator for Region 3 Behavioral Health Services, serving 22 counties in central and south central Nebraska. I'm here today representing the Nebraska Association of Regional Administrators and the Region 3 Governing Board in support of LB 362. As mentioned earlier today in my testimony on the Division of Behavioral Health budget a short while ago, I want to thank each of you for your continued support of behavioral health services, and especially for the $10.3 million carryover for provider rate increases, which was so desperately needed to address the circumstances that have placed our system at risk of losing services, of losing capacity and access for individuals. I appear before you today in support of LB 362, introduced by Senator Dorn. I wish he were sitting in his chair so I could thank him for his ongoing support of behavioral. He's a champion for our causes. The rate increase by LB 362 will provide that 5% additional rate increase for behavioral health aid, for children's health insurance, the Medicaid assistant, Medicaid expansion, and also for a provider rate increase of 5% for behavioral health services in the probation system through the Supreme Court. Each of the regions operates a network of community-based behavioral health providers and community coalitions, which provide a comprehensive array of treatment, rehabilitation, support, and prevention services. What each of our regional administrators hear from our providers whom we meet with or talk to on a daily basis is that expenses still outpace income. That rate increase that the legislature passed last year went primarily towards workforce retention and helping to pay for needed pay increases to remain competitive or filling vacancies that we're not able to hire for new staff positions. In fact, I was just visiting with one of our providers on Monday, and actually 2 or 3 of those providers, and who shared kind of this hope of we're being able to kind of turn the corner on the workforce issue. This is not a story that we hear very often in the behavioral health field, particularly in the post-pandemic world of behavioral health. Furthermore, providers have expressed serious concern about the availability of telehealth services. With the unwinding in the post-pandemic, many individuals have come to rely on services that have been provided via telehealth on secure platforms. Individuals in rural and frontier counties in Region 3 that Region 3 serves can avail themselves of services and really not have to leave their home. The reduction of reimbursement rates for these services, coupled with the continued increase in cost of technology, is something that continually affects providers. An increase like that envisioned through LB 362 can assist providers with continuing to provide essential services. In closing, the increase will be essential to continue forward momentum in Nebraska's behavioral health, and the Nebraska Association of Regional Administrators encouraged the committee to include the increase proposed in LB 362 in the 2023 through 2025 biennial budget. I appreciate your consideration and would be happy to answer any questions.
Senator Wishart.
Thank you, Beth, for being here today. So I'm going to ask the same question I asked before to the testifier. When I look at, for example, fiscal year 2021 to 2022 for behavioral health aid, so for program 38, we had about $35 million of unexpended appropriation. Can you help me understand when I'm hearing from other testifiers that there are wait lists, that the need for behavioral health support is increasing, why what we're seeing is the carryover funding consistently, especially since the pandemic?
Yes, thank you for asking the question. As Chase testified, the workforce issue continues to be a challenge. What we've seen through the COVID-19 pandemic is we have seen a lot of therapists leave the public behavioral health system and move into telehealth, working for national companies. They don't have to face the rigorous requirements through the paperwork that we require, the charting, and just being on call 24/7. Also, we experienced these continual delays from the Division of Behavioral Health. As was testified earlier, Medicaid expansion has really provided a wonderful opportunity within the behavioral health system. The regional administrators have worked with the Division of Behavioral Health, really trying to help them understand that this is an opportunity for us, that there are dollars that have been freed up. And as you heard some of the testifiers earlier, there's been 20, 30 proposals that have been presented to the division to help expend those dollars, innovative services. These services have been identified through community meetings, through meeting with our stakeholders of individuals who are out on the front lines, who know what the behavioral health needs is out in communities. And yet we've been, because of the rigidity, maybe the delays, we've just been able to, we've not been able to implement services. So there's millions of dollars worth of services that proposals have been submitted. There were delays. I think Patrick testified to one of the delays that Region 5 experienced was 288 days to get a proposal, to get a proposal approved. And then we go through an RFP process. We have a public process to get those dollars out there. The COVID-19, I think the kind of the moral trauma for providers has been significant there. There's just been a myriad of circumstances. And when you combine those, it's just created some real challenges to be able to draw those funds down. And as you've heard, the need for behavioral health hasn't changed. It hasn't reduced, it's gone up. And so we feel bad, we feel terrible that we're not able to get those dollars out where they're needed. And I don't think you were here when I testified about the crisis stabilization unit. We had dollars in our budget that were unused in the crisis stabilization unit, which is a core essential service, 24/7, serving people in crisis. They experienced increases in food costs, in their insurance costs, just the cost of doing business. And we couldn't help them. We couldn't help them address those costs, even though we had the money to do that, because the Division of Behavioral Health would not allow us to move dollars that were in our budget from a unit-based service, a rate-based service, over to an expense-based service. And services like the crisis stabilization, I always look at them, it's like you fund your fire station in your community. You fund them so that it's open 24/7. And I always tell people, I don't want the fire truck to have to stop at the gas station on their way to my house when I have a fire. So we have we have to provide that funding on an expense reimbursement basis to ensure that they're there, the access is available. But that inflexibility that didn't allow us to move dollars that we had over to where the need was.
Thank you.
Other questions? Senator Lippincott?
You have telehealth services that's up and running. Is it audio only? Is it audio visual, Zoom? And what percent of your services is telehealth? And has it been effective?
We have secure video, audio, and I can't tell you what the percentage is, but I will look that up and send you that information. Telehealth has been, it's been very helpful, particularly during the onset of COVID and the pandemic. Our providers, it was amazing. They were able to switch on a dime and start utilizing that telehealth platform, and that's effective. Now, I think that the ability to use that for some providers, maybe on the downside, was we then began to see therapists leave our system because they were comfortable with the telehealth piece. But it's extremely important, and particularly, you know, we serve about 15,000 square miles of geography in Nebraska with about less than 225,000 people. So it's extremely helpful.
Thanks.
Are there other questions? Seeing none, thank you for your testimony. Next proponent for LB 362. Welcome.
Thank you. Good afternoon, Chairperson Clements and members of the Appropriation Committee. My name is Kristen, Kristen Rodriguez, Rodriguez, and I'm testifying on behalf of Heartland Family Service and Nebraska Association for Behavioral Health Organizations, NAPO. You'll see I'm here in support of LB 362 and would like to extend our appreciation to Senator Dorn for bringing this bill forward. I'll let you read a little bit about Heartland and NAPO, which I know you've already heard a little bit about. To answer some of your previous questions, I want to let you know that in terms of Heartland Family Service, grants and contracts makes up about 48% of our revenue. Of that 48%, about 8% of that is through region contracts with probation, and 18% is insurance and Medicaid. And I hope that that's helpful to you all. Senator Dorn, we are grateful to you for your longstanding support. Appropriations Committee, your past support has not gone unnoticed by the behavioral health field and NAPO members. Today, I need you to understand why pushing LB 362 forward is crucial for the behavioral health field at this time, and I will use Heartland Family Service as an example to highlight why. The majority of Heartland's clients are Medicaid beneficiaries, and historically we have had many years of low rates. Previous 5% rate increases have helped us close the financial gap we experienced. For example, every Medicaid client who walks through our doors at this point in time, we automatically lose an average of 21 cents on the dollar for each service that we provide. To add to this gap, we recently, costs have increased by 20% across the board, further expanding this financial gap. The biggest costs of this 20% increase are salaries and the overhead of doing basic routine business. With inflation, the cost of living has soared, and our employees in Heartland as an agency are in pure survival mode. There's really no more room for any loss. The biggest consequence of the gap is lack of access and services to Nebraskans who are in need. When our rates are not what they need to be, we can't hire people at the salaries we're able to offer within our means, leaving the community at a loss. We aren't able to bill for services to have revenue because we can't provide them without staff. We can't fix our workforce issues without increased rates to be able to compete with private practices. Without a workforce, the access to service is lost for the communities who already have a hard time accessing it to begin with. One could say that this also creates a parity issue. The voters of Nebraska have pushed for Medicaid expansion, and Heartland has seen an increase in clients served due to that need
particularly in behavioral health services. We urge you to close this gap between reimbursable expenses and actual costs of service delivery. It's getting dire for us at this point. Please pass LB 362 out of committee. I'm available for any comments and I appreciate your time.
Other questions? Seeing none, thank you for your testimony.
Thank you.
Next proponent for LB 362. Seeing none, is anyone here in opposition? Seeing none, is anyone here in the neutral capacity? Seeing none, Senator Dorn, you're welcome to close.
Well, thank you for taking the time, Appropriations Committee, to hear some of the comments here on this. And I think between these comments and what we've had from the agencies today, I think I will just limit my closing and say thank you.
Are there any questions? Seeing none, thank you, Senator. And we have position comments for the record on LB 362. 30 proponents, no opponents, none in the neutral. And that will conclude LB 362. We will now open the hearing for LB 601. Is Senator Dungan available?
He's ready. Saw him there. He forfeits his bill. Let's move on. I'm just kidding. It's a new rule. I said he forfeits his bill. We just have to pass it. It's like, if you don't, if the governor doesn't touch it, it just
That's
passes.
the 30-second shot clock.
Yeah. If it doesn't show up, it just passes automatically. That's what happens.
You have to talk to the chair of rules.
That's true.
AKA the ruler. Chair rules.
If he doesn't show up, it just passes automatically.
Yeah, that's what I said. I have no idea.
What was 30 seconds, we just passed it.
Well, I answered my phone.
Subsection
I
5
know,
for
I couldn't
Rule
hear
3.
I was talking, so. My apologies. Sorry to make you wait.
That's all right. We just finished our previous bill.
Having a riveting day over in revenues.
We'll open the hearing for LB 601. Senator Dungan.
Good afternoon, Chair Clements and members of the Appropriations Committee. I'm Senator George Dungan, Georgedungan. I represent the people of Northeast Lincoln in LD 26. Today I'm introducing LB 601. Legislative Bill 601 would provide an 8.7% increase to reimbursement rates paid to providers of developmental disability services. DD services, developmental disabilities, DD services providers are experiencing massive staff shortages. Unlike other industries, DD service providers cannot adjust their prices or hourly rate. They are dependent upon rates set by the legislature. The average wage for a DD service provider is below $15 an hour. This forces many of them to have to seek state assistance to support themselves and their families. These staffing shortages have resulted in thousands of Nebraskans waiting for months of services. There are currently 2,000 Nebraskans on the wait list for services. This results in many parents or guardians having to take significant time off work or even leave the workforce to make up for gaps in service. This has a rippling impact on Nebraska workforce already struggling to fill available jobs. When I was out knocking doors for this campaign, I had an opportunity to talk to a lot of people in my district. We knocked over 10,000 plus doors. And one thing that I heard consistently from folks was how DD services or a lack of funding for DD services affected them. This was not a partisan issue, left and right and in the center. People mentioned the fact that they have folks in their family that are DD. They know people who are DD. They themselves fall into the DD community. And one of the things that I heard time and time again was that there is a lack of availability of services and a lack of funding for these services. I specifically remember one person I knocked on her door and we spoke about her daughter who's in the DD community. She's nonverbal. She spends most of her time in a bed in her room. We talked about the struggles the mom had to try to find services for her. And we talked for about 40 minutes, which I know is a big no-no when you're knocking doors because you're supposed to move on. But she was telling me just about her life and how hard this was. And she actually invited me inside to meet her daughter. I took her up on that. So I went inside and I met her daughter, who was nonverbal, but could interact and communicate in other ways. And her mom introduced me to her and explained to me sort of what their life had been like thus far. And she pointed at all of the different things in the room, medical equipment, various things she needed for mobility issues. And she said, all of this, maintaining it, has cost me tens of thousands of dollars, and it cost me about $5,000 a month just to continue to keep that up. And she'd been seeking ongoing DD services from providers and had been almost unable to find that for years. One of the problems she'd run into was just the lack of availability of those services. And that's one of the many reasons that this bill is incredibly important, not just to me, but to a number of people in my community and constituents of mine, but also I know for a fact folks in all of your communities as well. I know people who are DD providers. I know people who work in this world. I think a lot of us do. And I know people who are in the DD community themselves, and they need our help. And so I understand that there's a number of folks coming in and asking for an increase in provider rates. I know this is one of many, but I just wanted to highlight and underscore the importance of this and make sure we understand that there's a lack of services available. I think you're going to hear from a number of folks here today about what this increase would mean to them. And I would just strongly urge the committee to consider this increase at the rate we've requested. I'm happy to answer any questions you might have.
Other questions? Senator Erdman.
Thank you, Senator Clements. Thank you for coming, Senator Dungan. How did you arrive at 8.7?
8.7 was a number, there's a lot of conversations that went around that. It was a number that was given to me by individuals who work in and around the community. I believe they determined was probably going to be the appropriate increase to meet the need. The handout that I gave everybody here has a number of things included, but it shows what we're talking about in terms of the increase here. Senator Fredrickson's bill that's coming up after mine is taken into consideration there. But one thing that's highlighted at the bottom of that handout, I think, is that for the purposes of this bill, a 1% increase equals about 1.9 million. Based on that number or that estimate, I believe it was determined that 8.7 would get us to where we needed to be to at least be competitive or manageable, trying to fill all those needs. I understand it's a constant balancing act, and I don't envy the position that you all are in with all these competing different interests asking for money. But I do believe that 8.7 reflects where we would need to be in order to be appropriately staffed and provide those services. So I think that's where that number came from, is my understanding. And some folks after me might have a little bit better answer as to the history of that number and where that comes from.
So peculiar. 9 would have been a number. You know what I mean?
Certainly a rounder number, yes.
Yeah. Are there other questions? Seeing none, will you state a close?
Yes.
All right.
Thank you.
Sorry, I did have a question.
Oh, I'm sorry.
That's all right. I can
sit
sit down.
I just wanted to clarify, so at the very top of the sheet, you have 23 to 24, 19 million, right? Correct? From the general fund. And then the next year, 24, 25, you have 19 million twice. And maybe I'm just not understanding why it exists twice.
I believe it's the general fund for the subsequent year being included in there as well.
Is that what it is?
That's what I can double check. I'm
okay.
New to this graph as well.
I was just looking at the graph and then I
Yeah.
couldn't see it represented because I saw the 213 general fund budget.
Correct.
And then I saw the 233. So I'm assuming it's just, I guess, taking into account the previous year's rebasing. But
that's what I believe it is. It's taking that into account for the additional year. But Senator Wishart might.
Yeah, I was going to say, Senator, is it that you want to ensure this is not a one-time increase, but that going forward, this would be the percentage increase moving forward?
And that's what I'm trying to say when it takes into account the subsequent and previous year there. Yeah, it's an increase going forward. So not just a one-time increase and then steady there.
Very good. All right. Now we'll take proponents for LB 601. If you'd like to testify on the bill, would you move to the front seats, please?
Good afternoon.
Yeah, just a minute, we have people moving up.
Chairman Clements and members of the Appropriations Committee, my name is Matt Kosick, Mattkasik, and I am the CEO of Region 5 Services. We are one of the 6 service delivery regions originally established in 1970. Region 5 Services is a nonprofit political subdivision. We have 16 county commissioners that serve on our board, making us a public entity. Today, we are Nebraska's largest community-based DD provider, supporting 750 individuals with developmental disabilities in Southeast Nebraska. I included a handout in my packet that talks more about Region 5 services. First off, I'd like to share my gratitude regarding the provider rate increases that were passed last year. Region 5, my organization, would have posted a $3.1 million loss last year had it not been for those rate increases. Other providers were in a similar situation, and so to say it was a lifesaver is an understatement. This committee should be proud of the work they did, proud of the fact that you stepped up and ensured that Nebraska's most vulnerable citizens were taken care of. I share this so you know just how dire the situation was last year, but it's equally important to know that these increases did not solve all of our problems. We continue to struggle with staffing, much like other businesses, but the difference is that our work doesn't stop. We cannot close. We live alongside individuals with disabilities, which is a 24/7 commitment. The new funds appropriated last session amounted to $7.3 million more in revenue for Region 5 services. Most of this increase, roughly $5.2 million, went to increased wages and benefits for our employees. Region 5 employs 770 people, 90% of which are direct support professionals. DSPs, as we call them, provide direct care to the individuals that we support and are the backbone of all provider organizations. As a result, we brought wages up for this role as high as feasibly possible. Despite this, we still lag behind the market. One of our largest competitors now is the state of Nebraska at the Beatrice State Developmental Center, the BSDC. Direct support staff there earn significantly more per hour than what any community-based provider can pay their staff. Region 5 operates a location in Beatrice, so we see this firsthand. For comparison, Region 5's hourly wages start as high as $16.08 per hour for someone who has relevant experience. Our maximum rate is $19.96. The average BSDC employee earns $21.79 per hour on their first day. I've included a handout on that as well. The two roles are very similar. Both require the same amount of education, the same amount of work experience. The only difference is the setting. Still, we are losing staff to the BSDC, and we cannot compete with the rates as they are set. We've actually even lost staff from our Fairbury location, which is 37 miles away from Beatrice. This disparity in wages began in November of 2021 with good reason. Staffing levels at the BSDC were low. Something needed to happen to attract workers and to keep the residents of the BSDC safe. At that time, base wages were increased by 28%, and a $3 per hour shift differential was added for every hour, amounting to an additional 22% increase. All told, wages went up 48%. LB 601 is requesting an increase of 8.7 to provider rates, which ties to the increase in Social Security benefits. It goes a step further in continuing to improve the lives of those with disabilities in our state and improve the system. While we have not yet matched the increase comparable of 48% at BSDC, this will go a long ways in improving the system. The fiscal impact of LB 601 is $31.7 million over the next biennium, which I would point out is already appropriated. We estimate that $90 million will be unspent at the end of this year. I'd like to thank Senator Dungan for his dedication to Nebraskans with disabilities and for introducing LB 601. With that, I'm available for any questions.
Other questions from the committee? I had one question. I think I've been told in the past that the level of care of VSDC is more intense, higher need clients. How would you respond to that?
In some cases, yes. In some cases, no. So we have the unique position within Region 5 to be in Beatrice and close to the facility. I can tell you that we have supported individuals that at one time lived in the BSDC. Conversely, we have supported individuals in the community that have then moved into the facility. Staffing wise, we run the gamut. It's the same kind of situation where we've hired folks that have worked there, and folks that work there have left Region 5 to work there. We operate several facilities throughout, mostly group homes that are 24/7 settings throughout the state. I would contend that in a lot of cases, that person at a group home is a more intense, stressful position because most times you're the only person there. You're the only staff person there. So if something happens, you have to respond to that. You have to manage that issue. Whereas the BSDC has support staff built in. So yeah, it really runs the gamut of care.
Okay, thank you. I just wanted to have an idea of the comparable nature. Are there other questions? Seeing none, next proponent for LB 601. Afternoon.
Good afternoon. Thank you so much, Senator Clements and members of the Appropriation Committee. Thanks for the opportunity to come and share my testimony regarding LB 601. My name is Cheryl Wicks, CHERYL WICKS, and I am the Vice President of Government Relations for Mosaic. Mosaic is a nonprofit healthcare organization serving nearly 5,000 people across 13 states and in over 700 communities. In Nebraska, we support over 600 people with a workforce of over 800. Mosaic relentlessly pursues opportunities that empower people with disabilities, behavioral health, and autism, primarily serving people in home and community-based services in Nebraska. As I reflect on my 22 years of supporting people with intellectual and developmental disabilities, I have never experienced the pure exhaustion and difficulty that our organization has now. Pre-pandemic, we were fearful when our turnover was at 45%, and now our average is 84%. We used to be able to find numerous high-quality employees who were committed and reliable. But now we are having to make difficult decisions of limiting or closing our programs due to the lack of staff available. This is unacceptable. The people we support should be able to count on us and providers like Mosaic to provide all of the necessary services that they need underneath the home and community-based services. Through supporting LB 601, you are committing to people with intellectual and developmental disabilities in Nebraska that the following are important: quality of services over lackluster support, engagement with their own community, the quality of life for your constituents, and less stress on the government-funded programs due to income stability. Mosaic is passionate about serving people as a whole person and partnering for quality outcomes. Yet with our vacancies of direct support professionals averaging between 22% and 28%, this is forcing us to make these heart-wrenching decisions. Which programs do we maintain versus which ones do we close? What activities need to be limited due to lack of staff? Do we hire temporary staff, which means more training by our already stretched thin supervisors more often in order to ensure consistent services for people that we support? All of these and more are keeping me up at night. And so I start thinking of what kind of solutions can we have and how can we partner together to solve this problem? We can utilize those expected $50 million plus from DDD to provide services in a different way. For example, we could increase reimbursement rates for services being provided, which will increase wages and money being used more effectively and efficiently with the IDD system here in Nebraska. We are very grateful for the 15% last year, and we're starting to see some progress, although it's not exactly where we'd like it to be. As we look to the future of services, we need to challenge ourselves to explore more flexible service delivery options that are cost-effective for the state. By providing more personalized services with an elevated reimbursement rate, utilizing existing funds, it will help alleviate the DSP workforce crisis, increase continuity and consistency of care, and decrease safety concerns for those that we support. Thank you for the opportunity to share alternative solutions that support LB 601, which will directly impact the lives of those that we support in Nebraska. I'm available for any questions you might have, and thank you.
Thank you. Are there questions from the committee? Senator Dorn.
Thank you, Senator Clemens, and thank you for being here. Do you know in Nebraska about how much of a population you serve?
We serve approximately 600 people in Nebraska.
600 people, and about how much your workforce might be then?
About 800 people. 800 people.
And what, one of the previous ones had their average wage, do you know?
Mm-hmm. Yes, our average wage is about $14.75 an hour across Nebraska. And we would love to be closer to $18 an hour. Yes.
And you said you had approximately a 22 to 24% vacancy, workforce openings?
Yes.
So is that, when you said you had I think the 800 workers, does that count that 20-some%, or that would be above that?
That would be above and beyond. Yes.
Thank you.
Thank you.
Other questions? Seeing none, thank you for your testimony.
Thank you.
Next proponent. Welcome.
Thank you very much, Chairman Clements. Good afternoon, Chairman Clements and members of the committee. My name is Patrick Hayes, Patrick Hayes, and I'm the Chief Financial Officer of Elite Disability Services of Nebraska. Thank you so much for granting us this audience to speak on behalf of the people we are privileged enough to support and employ. As a veteran of the world's greatest Air Force, I've learned that the privilege to serve is accompanied by a responsibility to those we serve. The responsibility that lies before us is in addressing the crisis of care for the most vulnerable citizens of our communities. The solution to this crisis can, in part, be directly attributed to the opportunities that the passage of LB 601 creates to provide not only a livable wage to those who have dedicated their professional lives to the service of others, but also a competitive one. There are currently over 2,000 Nebraskans on the wait list for DD waiver services, and their current wait time averages 9 years. This is over 2,000 of the most vulnerable Nebraskans and their parents or guardians waiting 9 years for a glimpse of hope, only to have that hope stifled when they learn that staff shortages are now preventing them from receiving the services they have already waited so long for. The preservation of the status quo is no longer sustainable, and change is necessary. It is necessary because making a lasting difference in the lives of our most vulnerable citizens has risen to an incredibly high premium. In times past, this sacrifice was rooted in the ability to act selflessly and be intentionally patient in the service of others. Today, those sacrifices remain, but we have seen significant additions. Now it includes the ability to earn a livable wage and the peace of mind that comes from being truly content with the quality of life that your wages provide. All of this while working to provide a better quality of life for others who could only realize that life through the services our agencies provide. It is through the creation of a competitive wage that we can begin to address the crises before us, where job opportunities are abundant, but careers are being sought out. By definition, a job is any post of employment, but a career is a profession requiring special training, certifications, and professional memberships, all things required by those at every level of our very necessary profession. Couple that with the impending increase in the minimum wage in Nebraska, Currently, this skilled labor force makes on average $2 per hour less than the proposed increase. And this leaves us well below the requirement that skilled workers stay at least 150% above the rising tide of minimum wage. The set of circumstances surrounding the passage of LB 601 is married to our ability to affect change. As with any industry, money fuels innovation. Innovation in available partnerships and opportunities to create pathways to greater inclusion for the people with IDD that we are privileged enough to serve. These bills are not just about the wages we can afford to pay and remain sustainable. These bills are about the people who will be affected by the change you have the power to generate, and those of us gifted with the responsibility to carry it out. So that when our grandchildren ask us where we were when the most vulnerable among us needed leaders of compassion and purpose, we will be able to confidently look to you and say that we showed up, and we showed up on time. Thank you again for your time and for your consideration. You are truly appreciated, and I'm available for any questions you may have.
Other questions from the committee? Seeing none, thank you for your testimony.
Thank you, Chairman Clements.
Next proponent. Welcome.
Good afternoon, Senators. My name is Mary Kelly, Marykelly, and I'm with the League of Women Voters of Nebraska. The League of Women Voters of Nebraska supports an increase in pay for providers of services for citizens who are developmentally disabled, and we support instituting this change on an emergency basis. According to statistics from the Centers for Disease Control and Prevention, 1 in 6 children aged 3 to 17 years old has a developmental disability. Enacting a living wage for providers will increase access to quality, safe delivery of services to those affected by intellectual and developmental disabilities, which include cerebral palsy, autism spectrum disorder, and Down syndrome. These services are needed across the state and are presently suffering from low staffing. A survey of Nebraska Association of Service Providers indicated that members noted a decrease in staff turnover and fewer staff vacancies following wage increases in fiscal year 2022 to 23. However, the same survey reported that new referrals for support continue to be denied. Services are still being reduced, and grave concerns exist about remaining competitive in the labor market as the state minimum wage rises to $15 an hour over the next 3 years. Passage of LB 601 will have a positive impact toward increasing the good life of all Nebraskans. It will continue the state's move away from institutionalization and toward community-based services, a move which cost comparisons show are 75% to 95% of the expenditures for those in institutions. Raising reimbursement rates will also decrease the number of lower-income direct care staff who need to use the Supplemental Nutrition Assistance Program, Medicaid, Title 20 of the Social Security Act, and/or aid to dependent children, reducing costs and endless paperwork. This will save the state money and has the potential to raise self-esteem for workers who see evidence that others appreciate their value. Increased provider rates would shorten the wait list for people waiting for the approved comprehensive developmental disability waiver to be accepted and decrease the risk of people not receiving the full spectrum of services they need due to staff shortages. Finally, increased provider rates will reduce the inappropriate use of expensive emergency room visits. A member of our group shared their personal experience. When I was a young mother, I went to apply for my first real job and was denied because I have a disability. I had known about the problem, but I just had no idea it would block me from getting a job. Vocational rehabilitation sent me to school for a year. When I ran short of money, they paid my rent the final months of my schooling. This small thing changed the trajectory of my life for the better. I think LB 601 has the potential to do just that for countless Nebraskans. We at the League support an adequate compensation for providers of developmental disability services, so their needs, as well as the needs of the people they serve, can be met. We urge you to advance LB 601 to general file.
Thank you. Other questions from the committee? Seeing none, thank you for your testimony. Next proponent for LB 601. Good afternoon.
Good afternoon, Senator Clemens and committee. Before I start my more formal remarks, I would like to say that my name is Philip Gray, Philipgray from Omaha. And before I start my more prepared formal remarks, I would like to say that you are the effort who's allowed me to manage for my son. Without the support that you've provided, I don't know what would have happened, quite honestly. And we were quite lucky, really lucky, to not have a 5 or 8 year waiting list when he left school, because he left school during the Nelson administration when Governor Nelson actually eliminated the waiting list. I was actually part of that effort as a parent. Now we see the list where it is now. It's troubling to me. I've waited 20 years to see it eliminated, and it'll probably be another 20 years before I see it eliminated. I would suggest you should talk to parents who are waiting on that list for 6 years to see what funding would be appropriate to help with that. I've been a parent advocate for 40 years. I'm currently on the executive committee of Ollie Webb and the ARC of Nebraska. And I'm also president of Home at Last, a provider agency that does extended family services. I do have to apologize for my handout. I was planning this to go to the Health and Human Services Committee, but I gave it to you anyway, because other than the heading, it's the same thing. I'm here to support both bills, LB 526 and LB 601. You will probably have another hearing. The DD system in Nebraska and across the nation is facing severe challenges. They are not, as you've heard from the agencies, not able to meet the challenges that they have. They don't have the staff, they don't have the resources. Part of that, a major part of that problem is not only pay, but the direct service personnel, and I have to add the first line supervisors who actually stand in place of direct service personnel on a daily basis, because they have to fill in when the DSPs are not there. They're not staying in these jobs because of the pay, because the jobs are stressful, because there's no relief if they're working, and they're leaving for higher paying jobs. They can go to Target and make $18 an hour and not have the same issues that they have now and get support for college. As you're aware, Nebraska is primarily a state-funded NGO system. The majority of processes are with non-government organizations. These two bills, I think, are excellent in helping deal with the issues facing these folks. And hopefully they'll be able to take more folks off the waiting list, and hopefully there will be capacity to accept those folks, which is an issue, as you've heard from the other people here. With that in mind, I'd also like to suggest that both of these bills might be more appropriate if you would designate a percentage of these increases to go directly to direct line service people. That's a new concept. I don't know, that's one that's accepted in Nebraska, and maybe it's not needed because we don't know what percentage of the funds that received by the NGOs go to direct line service personnel. The DSPs and the first line supervisors need to be included in that, because the first line supervisors kind of have a job that they don't have enough resources to do and are required to fill in when the DSPs are gone. I just read an interesting study out of Massachusetts. It was the report by COFAR, the Massachusetts Coalition for Families and Advocates. Now, I don't know if this applies in Nebraska, but I think we should know. And I think that we need this information to kind of help plan management and our efforts at where we're going. They found in their study that between 2012 and 2020, each CEO pay went from 102 million to 125 million, while DSP staffing remained constant, was stable, was not increased. So while the management got a 23% increase, the DSPs really got nothing. Now, I don't, like I said, Nebraska is not Massachusetts, so I don't know if that applies here or not. But it would seem to me that we ought to know that. We ought to know how much the money we're spending goes and where it goes, and whether it's involved with direct services, whether it's involved in management, whether management is getting an adequate amount. And I think I'm out of time.
And that's your time.
Are there any questions?
Any questions?
I haven't heard from any parents but me today, so I appreciate the time. Thank you.
Thank you for coming. Next proponent. Welcome.
Hi, good afternoon. My name is Kristen Larson, and that's spelled Kristenlarsen. And I'm here on behalf of the Nebraska Council on Developmental Disabilities to testify in support of LB 601. Although the council is appointed by the governor and administrated by DHHS, the council operates independently, and our comments do not necessarily reflect the views of the governor's administration or the department. We are a federally mandated independent council comprised of individuals and families of persons with developmental disabilities, community providers, and agency reps who advocate for systems change and quality services. And when necessary, the council takes a nonpartisan approach to provide education and information on legislation that will impact individuals with developmental disabilities. LB 601 would make it possible to appropriate additional funds to implement that 8 7/10% increase to reimbursement rates paid to providers for DD services. It's an important bill as a tool for the state of Nebraska to address the critical workforce care crisis due to staff shortages among DD waiver service providers. It's no secret that Nebraska, like many other states, is experiencing a crisis of not having enough direct support providers or DSPs to provide the critical habilitative residential care, employment, and behavioral health and medical assistance services to individuals with DD who are eligible for home and community-based services. The HCBS infrastructure in Nebraska and across the nation is in free fall, and the action is needed to address this emergency. Individuals, currently over 5,000 Nebraskans receive some sort of DD services in our state. And they receive those by agency and independent providers in all rural and urban areas in Nebraska. Individuals with DD and their family members rely on these critical supports to stay connected to their community and avoid isolation. Without them, many parents and guardians would not be able to work and contribute to Nebraska's economy. A high-quality DSP workforce that earns a living wage is essential to providing the necessary support and services to Nebraskans with DD where they live and work. As you know, Medicaid's a primary source of funding for the programs employing these workers. In the current Medicaid reimbursement system, ongoing concerns with potential cost-cutting actions by state legislatures and Medicaid officials, and recent strides to raise the minimum wage in several cities and states, including Nebraska, have exacerbated the workforce crisis across the nation. DD waiver providers are truly hampered by low wages, a lack of affordable health insurance, high turnover, and a shortage of staff. Demand for these workers from private industry and other human services sectors is also high, leading to competition among millions of people. These problems have been compounded over 3 decades, leading to a crisis that presents a grave threat to the lives of people with DD and their families. Don't forget that we have many individuals with DD who currently are not receiving these DD waiver services or who are receiving partial day services while they await comprehensive waiver supports. These individuals receive help and supports from family and unpaid caregivers, and burnout is inevitable. The reports they provide are critical, and yet we do not have sufficient data for strategic future planning conversations and exploration of community-supported living options and employment goals when family caregivers can no longer provide adequate care. LB 601 is a mechanism to address future planning to establish capacity in the waiver system. Nebraska must ensure adequate funding so that DSPs are paid a living wage or as much as other jobs in the area that require the same skills or market wage, whichever is greater, including appropriate benefits. Community DSPs should earn as much as their peers who do similar work in the state-run ICF at the BSDC, just like you heard in the previous testimony. But unfortunately, they do not. And the council fears that some senators and Nebraskans think that the provider wage problem was solved last year with the historic 26% rate increase, where 17% of the rate increase was done with permanent funding and 9% was done with temporary one-time ARPA funds. The temporary increase must become permanent, especially in light of the minimum wage increase and soaring inflation rates. The investments must be made so that DSPs are earning more than the 150 above minimum wage rates. Providing adequate reimbursement rates to cover waiver services also includes appropriate staffing levels to ensure the provision of person-centered services. Without this investment, providers might decline referrals or give notice to stop providing essential services, placing people with DD at risk for institutionalization or creating a situation where family members are forced to provide these supports without any type of compensation. Legislation like 601 and LB 526 will help Nebraska implement a plan to address all relevant components that drive the crisis, including low wages and reimbursement rates, high turnover, and inadequate training. The council prioritizes advocating for access to community living and supports, and we hope that our speaking up encourages all of us to bravely have uncomfortable conversations resulting in adequate provider investments. Thank you for your time.
Thank you. Other questions from the committee?
I might note too that I'm also a parent, happen to serve as executive director and have been personally impacted by the crisis. And so I just appreciate that you're taking this into serious consideration.
Thank you.
We do have questions. Thank you. Thank you, Senator Clemens. Thank you for being here. So your Development and Disability Council, talk a little bit about that. How many people are on it and when was it formed and that type of stuff?
There's a state DD council in every state and territory in the nation. We are federally mandated from the Developmental Disabilities Act that was passed in 1970. In Nebraska, we have 25 governor appointed members. 60% of those members are actually family members who have a person with a developmental disability in their family or an individual with developmental disabilities. So, and then we look at the gaps and barriers across the state. We have a state plan that looks at those areas, and we give out innovative funding to do some great work to address those issues, as well as use staff time to work towards making improvements in those areas. So we're tied also to national peers and are very aware of this DSP crisis. It's not unique to Nebraska, but it is, yes, definitely an emergency that we need to address.
Thank you.
Thank you.
Seeing no other questions? Thank you for your
Thank
testimony.
you. I appreciate it.
Are there additional proponents for LB 601? Seeing none, is anyone here in opposition? Seeing none, does anyone wish to testify in the neutral capacity? Seeing none, Senator Dungan, you're welcome to close.
Thank you, Chair Clements, and I want to thank the folks who came in and testified here. I know that this is a big issue for a lot of people in the community, and so I appreciate them taking the time to come do that. I want to make sure I say that on the record. To clarify a couple of things, the handout that I gave, we're going to verify some of the numbers on there. It is correct. It just takes into account, I believe, two different bills, the one that you're about to hear from Senator Fredrickson, as well as mine. In addition to that, just to clarify, the intent behind this bill was to have an 8.7% increase in the next fiscal year and then an additional 8.7% increase from that in the year following that. And so I think that's where some of the confusion maybe comes in the different numbers there that are being added up. And I think that, again, I will verify all of those numbers, but I just wanted to make it clear to the members of the committee that's the request. One of the other folks who testified, Senator Erdman, I think answered your question maybe a bit clearer as to where that 8.7% came from. It's trying to mirror that Social Security increase that was also given. And I believe that was a number that was provided as a starting point in terms of what would be an equitable sort of increase in this as well. The reason we're asking for that 8.7 increase in one fiscal year and then an additional 8.7% increase in the next is that's what's going to really get us to a competitive place. I think the folks who came in here and testified today did a really good job of outlining the importance of making sure that large-scale providers have the ability to pay their folks and the importance of making sure that direct service providers are paid a fair wage for the hard work they do. As I said earlier, and I don't want to belabor the point, but I have very close friends who have worked as DSPs, who have been direct service providers. And it is incredibly difficult work at times, and they oftentimes felt very underpaid. They had to leave those jobs after years of working there simply because they couldn't make ends meet. In preparation for this bill, I had a chance to go tour some facilities that do service work, where people go to do day programming. Folks in the DD community will go and spend their days there doing social programming and also learning life skills and things like that. And what I heard from the folks who run those facilities is that they're struggling right now to find people who want to make it a career. We see folks pop in and pop out. Maybe they spend a year there, 2 years there, and then move on to another field because they struggle to make that a career. And what they were lamenting is the fact that you lose a lot of institutional knowledge and you lose a lot of the folks who really know what they're doing, who can care for folks in the DD community and provide that support. One thing that I know is incredibly important oftentimes in this service providing and in the care that's being provided is the long-term emotional connection that you can sometimes build with a service provider is huge. And it's vital to make sure that there's a continuity of services. And when you have constant turnover and when you have people leaving the field because they literally can't pay their bills at the end of the day, it's a problem. So again, this is not a partisan issue. Happy again to clarify some of the numbers on that. But it seems to me that this is integral to ensuring that we make sure that service providers get a living rate and get a living wage. And in addition to that, I would also just like to highlight the rippling effects that happen when there's not adequate service providers. And what I mean by that is it doesn't just affect the folks in the DD community. It affects maybe their parents, who you heard today have to take time off work or have to quit their job to then care for their kids because they can't find a service provider. And then that has the rippling effect of the parent no longer working, which causes a labor shortage, which then people are asking, well, where are people? Why aren't they working? It really is this rippling out effect when we don't provide for folks the way that we should. Happy to talk about whether or not that number is what the committee thinks is appropriate. I think we can continue to have these conversations, but the bottom line is that we need to make sure that our service providers are getting reimbursed at a higher rate because it really does affect everyone in the state. So happy to answer questions, and I would urge your consideration of this bill.
Any questions? Seeing none. Thank you, Senator.
Thank you.
Regarding LB 601, we have an ADA accommodation testimony from Leslie Bishop Hartung, one proponent, no opponents, no neutral. And that's all we have for comments. No? Okay, excuse me. Okay, online comments. We have 11 proponents, no opponents, none in the neutral on LB 601. Thank you. That concludes LB 601. We will now open the hearing for LB 526. Senator Fredrickson. Welcome.
Thank you. I'm making my appropriations debut. Good afternoon. Thank you, Chair Clements and members of the Appropriations Committee. I am happy to be here today to, well, for the record, I'm John Fredrickson, John-Fredrickson. I represent District 20, which is in Central West Omaha. I'm happy to be here today to introduce LB 526, which appropriates funds to the Department of Health and Human Services for Developmental Disability Aid. The appropriated dollars in LB 526 will allow the state to make up for expiring ARPA funds for developmental disability services and allow for federal matching funds. Essentially, this bill will ensure that those FY23 temporary ARPA funds for services requiring staff are permanent. Specifically, these funds will help ensure necessary staff levels for our providers. There's a crisis of care, as we've heard from some of the previous bills, due to staff shortages among developmental disability service providers. In our highly competitive labor market, these providers are dependent upon rates set by the legislature. Funding needs to be sufficient to reduce waiting lines for services. Supporting those with developmental disabilities should be among the state's highest priorities. The general public often incorrectly assumes that disability services are an entitlement, meaning anyone with a verified disability receives the services that they need. This is unfortunately not true. The reality is a wait list can last years. I am aware that there are significant unexpended dollars for the Developmental Disability Aid. We need to get a better picture as to why these dollars are not being spent. Clearly, appropriating more dollars for workforce development is a critical component to addressing the problems of waiting lists. So I would ask that you ensure that these appropriations are part of our budget. I know Governor Pillen also includes these appropriations as part of his own budget proposal, so I'm thankful for his support of this funding. With that, I'd be glad to answer any questions you may have. I'll keep this quick. I know it's the penultimate day of hearings, and so I appreciate you all being here and paying attention still, because it has been a long ride. So thank you.
Other questions from the committee? Seeing none.
All right. Thank you very much.
Senator. We welcome the first proponent for LB 526. Good afternoon.
Good afternoon. Thank you, Chairman Clements, members of the committee, for the opportunity to speak in support of both LB 601 and 526 today. My name is Elena Shriver, ALANA-SCHRIVER, and I'm the Executive Director of the Nebraska Association of Service Providers, which is the statewide association for those home and community-based providers of IDD services. We're extremely grateful for the life-saving rate increase last year, without which the crisis of care would be even more catastrophic. But prior to today's testimony, maybe there was a misassumption that that was profit for providers, and that's not correct. As you've heard from our provider members, we're barely getting back to zero. We were in the red so hard that this is almost getting us back to the starting point where we hope growth and innovation might be an option down the road. But until we address the staffing crisis, that's just not a possibility. ARPA being made permanent would allow, with it temporary, we could only do bonuses, hiring bonuses, retention bonuses, but making it permanent would actually allow some of that healing to take place, where you could raise wages and actually keep staff and attract staff. So these bills should not be viewed as a rate increase, but rather a prevention of what effectively would be a decrease in rates without them. And as much as we would prefer to come before you each year with plans for growth and innovation, we're ready in our legislative efforts to just beg to remain solvent and keep our doors open until rates are tied to some metric like CPI index or some other method down the road, hopefully. The businesses NASP represents are utterly essential and nonpartisan by nature. Without community service providers, parents like myself and Phil and Kristen may have to leave work, as Senator Fredrickson mentioned, what happens when you're not working? You become reliant on state assistance like Medicaid and TANF and food stamps for your own families. It's also worth noting, as someone from Albion, that when there aren't home and community-based services in the rural areas, you lose families, you lose population when they're forced to move to a place where services are available. We've heard from previous testifiers about the low wages DSPs with their own families, forcing them to often be reliant on economic assistance as well. So I'll change up my testimony a little bit to just point out some of our DSPs are job coaches, and they help the individuals they support get competitive integrated jobs in their communities. And it can be a little demoralizing when you're helping someone get a job that pays more than your own. And, what's to stop them from filling out that application for themselves along with the person that they're supporting? And to address Phil's very valid concern and other people's concern that rate increases might go directly to CEOs or presidents, there is obviously a need for admin staff when you're working with vulnerable individuals to ensure high quality and oversight and make sure people are safe and doing their jobs well. But our cost reports are public. We have to submit cost reports for the past 2 years to DHHS, and those are audited. So you can see how much is going towards admin versus direct line of care staff, if you so choose. The DD division at DHHS is on track to leave $90 million in unexpended funds on the table this year. those unexpended funds would cover the cost of both LB 526 and 601 for the biennium. Basically, we haven't made it possible yet to spend down those funds. Without higher reimbursement rates, we can't offer the wages that will attract staff. Without staff, we can't provide services. When you don't provide services, you can't bill for services, so you can't spend that money. So if we can raise those reimbursement rates to enable us to actually hire people and start serving people, then that money's going to get spent down really quickly. I did have a handout of that survey. A previous testifier mentioned about our members and having to cut programs or turn down new referrals. So you can see those numbers on that handout. And you understand already that raising wages is what it takes to get this work done, which is why it's happened already for BSDC. And we just ask that you allow us to do the same with our own staff. So I'm happy to answer any questions.
Other questions, Senator Vargas?
Thank you for being here. And I didn't want if you wanted to comment on this, because the way you just described this, the problem that we're having, the nearly $90 million funds available, but reimbursement rates not allowing us to utilize it. It sounds a lot like the problems we had in 2020 when we were dealing with our correction system, and we would appropriate every year based off of the demand and need of staff. And the administration kept wages pretty stagnant. Until they adjusted their wages, they weren't able to actually utilize those funds. However, they kept requesting it and we kept appropriating it. The only difference here is we can do something about the reimbursement rates. I appreciate you bringing that to light, because I think that's an important distinction. We can keep appropriating funds, but if we don't actually increase the rates or make that very clear in our intent language, it won't get out to you. And then the question will be, why are we continuing to appropriate funds if they're not going to get out for the rates? So exactly. I didn't know if you wanted to comment to that, but that was just very helpful.
You nailed it. The only thing I would add is for individuals with developmental disabilities, depending on your individual need, you have a budget that might look different to your roommate at the group home or someone else. And so a lot of individuals may require 2-to-1 staffing or 3-to-1 staffing. And you might only have one staff member available at your agency, and then you can't support that person. And so some of the appropriated funds is dependent on the individual's budgets, which is taken into account because we know what those are. But you're exactly right. If we can't if we can't pay people more, then we don't have people to support those people in Nebraska.
Thank you.
Other questions? I just had a comment about one disadvantage you have. As I calculated, the pay that the committee receives is $5.76 per hour.
But we have to work 365 days a year, 24 hours a day, 7 days a week. We don't get holidays. We don't get anything.
But we asked for it.
We're all very deserving. Public servants. We're all public servants. And I might add as a parent that to Senator Fredrickson's point that a lot of people assume it's an entitlement. I don't know if you've seen the movie Champions yet, but I would encourage you to. I went with a friend and one of the characters has traumatic brain injury. And so I had mentioned, only 20 people a year in Nebraska can get that support. And she was absolutely shocked. And a lot of times I'll have my son at a doctor appointment, and even the medical professionals, when I ask, oh gosh, how much is that treatment going to cost? They're like, what do you mean? Medicaid's going to cover it. And I'm like, I don't have Medicaid. And they just assume because he's disabled that everything falls into place and that those people are taken care of. And that's just not the reality. Even though
Senator Erdman, did you have a question?
Yes, Senator Clements, FYI, if they figure every hour is $1.37, we'll make it $1.37.
I only use 40 hours a week.
Every day of the year, every hour, 137.
Okay.
40 hours a week? Never mind, keep going.
Well, thank you for your testimony.
Thank you.
Next proponent. Good afternoon.
Good afternoon.
Hello, my name is Edison McDonald, EDISON, MCDONALD. I'm here representing the ARC of Nebraska. We're Nebraska's largest membership organization representing people with intellectual and developmental disabilities and their families. We support LB 526 and LB 601. We must protect the rate increases made last year for disability service providers. We need to ensure both agency and independent providers have adequate funding. If we underfund this system in the short term, we see the significant impacts that cost us more in the long term. The state does not get to choose if they will serve people with disabilities. They can only choose where they serve them. As you can see in the chart attached from information in our 2019 waiver study, if we serve someone in community-based services off of the date of application of the waiting list, it's about $33,771 per individual to serve someone. However, if we wait and they don't get services when they need, the average cost spikes. From a foster care placement, which is priority 3, where we would pay $97,408, to an institutional placement like BSDC, that the cost is $221,920 per person per year. That doesn't even mention the 3% of people with intellectual and developmental disabilities who we have on our waiting list of over 2,000 people. Further, it doesn't even begin to address the 80% of people with intellectual and developmental disabilities who get nothing. This is comprised of 2 main groups: those who don't realize what is available and people who don't meet our narrow eligibility criteria. That could mean they have significant disabilities but fail our problematic eligibility process that says you can eat if you can raise a spoon, but it misses that they can't get the spoon all the way to their mouth. Or it could be an individual with autism that has an IQ that's too high. However, it isn't considering the co-occurring behavioral health condition that to an average citizen, they would realize they need supports. When we fail to keep up with proper rates, we risk losing more providers. The disability system is actively crashing. After critical underfunding for so long, we have failed to provide adequate support for people with disabilities. This is not solely a Nebraska problem. It's happening across the country. Unfortunately, our plans for our disability system have been short-sighted. We need to begin looking at how to deal with the staffing crisis, which is not a short-term issue. We've lost so many baby boomers from the workforce, and we don't have enough Gen X, millennials, or Zoomers to make it up. Our radical underfunding has left rural communities starkly underserved. You can see on our attached resource map below a list of providers across the state that if you have a kid with a disability, you are significantly forced to look towards more urban areas. We need to ensure this funding. We need to make sure that we are making forward-looking investments in technology, reform our waiver system, which LB 376 that was passed last year has a contractor looking at. We need to allow legally responsible individuals to be paid, and we need to tie rates to COLA. This will ensure that our private providers have a stable market that will ensure they can plan for steady business. Many states that have tied minimum wage to inflation, like Nebraska, have done this, and it will ensure DSPs will receive adequate pay. Most importantly, we need to start planning with a long-term vision and an open mind to defend the system that cares for our most vulnerable. With that, any questions?
Senator Wishart.
Thank you so much, Edison, for being here. Is there a piece of legislation introduced this year that would tie funding to inflation?
There's not, but I think there should be.
Okay. That's something I'd like to talk with the open somewhere.
Yeah.
Other questions from the committee? Hearing none, thank you for your testimony. Next proponent.
Hello again.
Welcome.
Mary Kelly, MaryKelly, the League of Women Voters of Nebraska. The League of Women Voters of Nebraska supports an adequately funded mental and behavioral health care system that provides comprehensive and coordinated services for children and adults. As such, the League supports appropriating funds to the Department of Health and Human Services to support individuals with developmental disabilities in our state. These funds are needed to help keep providers open and serving one of our most vulnerable populations. Several providers closed in the wake of the COVID-19 pandemic, leaving families struggling to find independent providers to care for their loved ones while taking on the added task of managing care for their children. If they cannot find a provider, they end up needing to leave work to care for their loved one or losing employment. The Kaiser Family Foundation reported that nearly all states reported at least one provider closing following the pandemic. Nebraska continues to struggle with its wait list for developmental disability services, which may reflect both shortages of workers and insufficient state funds to provide services for all who need them. Disability providers have indicated through the Nebraska Association of Service Providers that they are still struggling to find workers to fill needed positions to care for individuals with developmental disabilities. With the raise to the state minimum wage, providers are concerned that they will not be able to retain qualified caring staff to support individuals in the community. Making the ARPA rate adjustment permanent will allow providers who care for individuals in the community to continue to hire and retain quality staff. The League urges the Appropriations Committee to support LB 526 and move it to full debate by the legislature.
Thank you. Are there questions from the committee? Seeing none, thank you for your testimony. Are there other proponents for LB 526?
You just can't walk at the same time.
Come back.
I'm coming back, but just to go on record, and I'm not going to read my whole, because it's essentially the same that I gave earlier, but I just want to, again, just to say, my name is Kristen Larson, Kristen Larscn, and I'm here on behalf of the Nebraska Council on Developmental Disabilities. For those of you who weren't here earlier, I explained that there's a DD council in every state and territory in the nation. We're federally mandated to work together to improve system change, to make systems changes and address the needs in our state. Our governor appoints our 25 members. 60% of those members are individuals with developmental disabilities or family members. And then we also have agency representatives and community providers and others who advocate for quality services. And it provides a unique opportunity for family members to sit across the table from like Director Tony Green and be able to push back a little bit and to also collaborate. We do a lot of collaboration with the DD division as well. So that's a plus. But the topic of provider rates is a hot one. We've never come in to testify publicly on this. This is the first time that I'm doing that. And I can tell you that it's an important thing. And that's why we want to support LB 526 to make sure that we're making that ARPA funding from last year permanent. Back to what we've been talking about, it all comes down to stabilizing what the house is on fire, and we have to stabilize it or people are very much at risk. And I want to remind you guys that March is Developmental Disabilities Awareness Month. It was put into practice, or it was President Ronald Reagan is the one who proclaimed the month of March as Developmental Disabilities Awareness Month. And the purpose was and continues to be to urge all of us as Americans to see the benefit and the dignity that individuals with intellectual and developmental disabilities bring to our communities. And in order for them to lead productive lives and achieve their potential, they're going to need good supports. We have to have good DSPs and good provider supports if we really truly want folks to be included in all parts of community life and for them to live the lives that we want them to live. So with that, I'm just going to echo what everyone else said and just want to be on record again, but both of these bills would definitely be a step in the right direction. Thank you.
Are there questions from the committee? Seeing none, thank you for your testimony. Are there other proponents for LB 526? Seeing none, is there anyone in opposition? Seeing none, anyone here in the neutral capacity? Seeing none, is Senator Fredrickson here to waives closing? Senator Fredrickson waives closing. And we have comments on LB 526 We have an ADA testimony from Leslie Bishop Harta. One proponent, no opponents, none in neutral. We have other position comments for the record. 9 proponents, no opponents, none in the neutral. And that concludes LB 526. And that concludes our hearings for today.